whatever it takes, whatever you know you can do to ensure that your clients is well, the well-being should be of paramount concern and interest to you. We also looked at person-centered care, and we did say that person-centered care talks about you channeling your care, channeling your services to fit your clients, direct it towards what your client wants. At the same time, emphasizing, or at the same time respecting the individuality of your clients, respecting your clients' preferences, and also ensuring that you don't do a human being, feel less of himself or herself. You are very important in the lives of those that you serve. Never forget this at any point in time as a caregiver. Never forget this. And also the positive impact that you can have in their life if you do the right things. Remind yourselves of this. So today we want to look at another module, which is infection and infection control and prevention. That is what we want to look at today. Now, let me ask, which I already know, have many of you or any of you ever had a cold or flu? Right now, as I'm talking to you, I have a little bit of cold. I have cold, and it's because of the weather. So I'm an example, but I know with us here on the platform, nearly every Good evening. Everybody should pray, whether Christians on the platform or Muslims. Please let us pray that network favors us, because the weather is very bad in this part. It's very terrible. So I pray that we don't get issues of network. I just want us to have everything done smoothly. As I was saying that everybody on this platform at one point or the other may have been dealing with infections or preventing the spread of illnesses, trying to see how to handle the weather and the cold. So today we are looking at infection control and prevention. Let me start by asking, like I said, and as I've already said, I'm willing to bet that all of us in this room in a care facility. For instance, like we talked about residents, like last week we talked about the difference between clients and residents. Please, as usual, remember that you can easily drop your comments, whatever comments or question or anything in the chat box. I'm definitely going through it and seeing how best we can move. All right, so as I was saying, let's see what we have there on the next slide. Breaking the chain of infection. Now we are going to, under this infection prevention and control, we are going to look at two aspects of it. Breaking the chain of infection and blood pathogens we are going to look at. So the first one we want to look at now is breaking this chain of infection. Of course, infection diseases are very dangerous for older adults, like I already said. As we grow older, our bodies begin to get frail, begins to get weaker with age. And so that's why it's easier for a much younger person to be able to fight a particular illness than someone that is old that is elderly, you understand? So there's definitely a difference. As we grow older, our bodies become weaker. So it's difficult for us to fight all those illnesses that come, especially those associated with old age. So infectious diseases are very dangerous for older adults. Then when providing care as a caregiver, when you are providing care for this older adult or for those people that are under your custody, it is very, very important that you understand that you have to be very, very careful. You have to be careful because it's just like a nurse. Before I actually moved into exploring the health sector, I used to wonder, I said, nurses, how do they cope? Because even a mere sight of me, I mean, not sight per se, but a mere me just moving into a hospital or to a health facility, and I perceive the smell, for instance, going to the ward, maybe just the smell around the environment, it has a way of affecting me, just that alone. So I wondered, I used to think, how do nurses cope? How do they manage? That is something that how do they cope with all these things? Very, very important. And this chain of infection, like we said, when one person, those of us that are mothers here will relate better to what I am trying to say. And when in a family where we have maybe 4 children, if one child develops any infection, maybe a catarrh, maybe cold, or maybe a cholera or something that is contagious, if one of your children has it, mothers can relate to this. You will hear a mother say, I need to treat all of them, or because I know that now that John is down, I know Mary is going to also be down very soon. So you see that tells you that, especially in a confined setting, people that share things, people that remain in the same space, easily get infected. If one person is infected, it easily spreads. So caregivers must understand that must understand infection spread, and they must use standard precautions to break the chain of infection. Because if a caregiver is actually infected, you have an infectious disease, it's in a speed of lightning, your clients can actually contact that from you because you are there, close proximity, and you deliver hands-on care to this person. So it's very easy for this person to contact the infection. So what we are going to be looking at in most of these slides, are going to be vice versa. What I mean by vice versa is on the part of the client and on your part as well. So breaking the chain of infection is both ways, both on the part of the client, because if your client is infected and you don't take the necessary precautionary measures, it becomes an issue. You will easily get infected and you will move around the facility and get others infected, or even in the house, you get others infected. So it is important that we take this particular module very, very seriously, because it affects us. In our duty, we have to stay safe. As caregivers, we have to remain safe. You don't want to expose yourself to risk or to hazard in a bid of taking care of another person. Of course not. So that is why it is important. So let's see. Now, what are these infectious diseases? Now, these infectious diseases can actually cause pain. They can cause injury, disability, or even death if not properly handled. Now, they can be spread through maybe bacteria, virus, fungus when they enter a person's body. And when they enter a person's body, they multiply. Just like multiplication table, those of us that still remember our mathematics in those days. So when it gets into the body, it multiplies. And what are some of these infections that we are looking at or want to look at? We have the UTI, the urinary tract infection. This is one infection that I say has affected from experience and from maybe talking to those that are actually directly involved. You discover that this UTI is one infection that really, really affects people, especially women, urinary tract infection. Why? Because of just the way, our own anatomy, the way a woman's body is. So we're easily prone to getting anything that comes across the way. It easily affects us. So urinary tract infection is one infection. Then skin, nail, or wound infections, illnesses involving diarrhea, pneumonia, and so on and so forth. These are different types of infections. If you remember, those of us, that's why I told you that this in caregiving has a way of interlocking, is intertwined. One topic still dances around, picks some from the other topic. It just keeps moving around. That is how caregiving is. We said something earlier before now. I told you that I think the first day or the second day, that it is very, very, very important for us to ensure that we have all the things that are necessary when we are attending to a client. Very important. You ensure that Good. So what are we trying to talk about? All these illnesses that we have seen here are illnesses that can easily be transferable. It's infectious. It can move from one person to another, especially in a facility. Now, depends on where you want to work. Some of us may end up maybe just being an unpaid caregiver, like the one person that is not paid. You are taking care of your mother or your elderly, your grandmother, or someone you are not being paid for it because it's a family member. You could equally be a professional caregiver too. So if you're a professional caregiver, then you have to adhere to the rules, to the policies involved. If you are in a residence, because in a residential setting, that's where you have, it's like a hostel where you have different people. You are just there, and probably you are in shift. You have people that come around, another set of people, and so on and so forth. So you have to ensure that you stay safe. You stay safe so that you can prevent these infectious diseases. And we did say something the other time that when we're talking about caregivers' responsibilities, we did say that whenever you are not feeling well as a caregiver, whenever you are down or you are under the weather, try to take permission and stay away from work. It was one of the things we said. Do not say, because I love my job, I cannot just afford to stay back. If I'm not there today, this will happen. No. I tell you, if something happens to you, God forbid, today, the job moves on. In fact, if they even take up to 24 hours before getting another person, it means that you are extremely lucky. Before in a flash of lightning, another person is substituted in your place. So you have to look out for your welfare. When we get to caregiving skills, when we get to care for self-care for caregivers, we'll really talk about that. So these are some things: fever, chills, sweating, and so on, decline in overall well-being, rash. These are some things. There are things that you would see, signs, and then symptoms that you say, this person is actually infected. Infection doesn't just happen like that. Aside you even going to the hospital to do the test, to actually understand whether someone is infected or not, you can see some signs. You can see maybe hot or dry skin. You can see rashes. There are some people that maybe this urinary tract infection, what it brings about, it causes rashes. You see rashes all over the body. As a caregiver, not only your own body, observe your clients, observe your patients, observe the person you are taking care of. These particular points cannot be overemphasized because, like I said, a caregiver, you have to be sensitive. You have to look out for any little sign. We are going to get to body care. We are going to get to skin care. As we progress in your duties, performing your activities of daily living, do not lose guard of the fact that you have to be very, very observant. Check through. I said it last week. Go through, look at the skin of your client, check and observe anything that seems out of the ordinary or anything that is unusual. Look at it and do something about it, and notify your care team. You don't work alone. Remember, you work with other people. So notify them at any point that you see anything. You see sores, you see wounds, you see anything of that sort. Notify your care team because you are working together as a team. This is very, very important for us to take note. Okay, now let's look at chain of infection. Remember, we were talking about breaking the chain of infection. Breaking the chain of infection. This is what we want to look at now. Now, this is a chain. If you look at it, it's just like the chain that we wear on the neck. It's interlocked. It's moving round and round. So let's look at this chain of infection. But before we continue, I need to find out, let's see the people that are right on the platform. Before we continue, can everyone hear me, please?
I can hear you, ma'am.
Hello.
I can hear you, ma'am.
I can hear you, ma'am.
Okay.
I can hear you, ma'am.
Thank you. I'm still particular about Jovita. Jovita, I don't know who is using the 799-653. I don't know who that is because there's no name against it. And I can see Madam Sylvia, Vanessa, Pounds. Pounds, I think Uchechuku also. I'm trying to remember because these Pounds I keep forgetting. Then Ugoeze, Messi, Idara, Madam Kusan. It's nice to have everyone here. Kingsley, Mr. Kingsley, Joy, Imutian, Caring Queen, Adeni. Okay, I'm yet to know is 79. 99653. I'm wondering why Jovita is not here because she just joined us. But nevertheless, let's continue. So the chain of infection is a useful framework for understanding how infection is transmitted in care settings. It is important for us to understand how infection is transmitted in a care setting, in where we have people. Now, let's first start with these infectious agents. This is the first circle there. I guess everybody can see. Please, can everybody see my slide of the chain of infection?
Yes. Yes, we can see.
Yes.
Okay.
Yes.
Okay, Jovita is saying, I am here, ma'am. Okay, Jovita, because I couldn't identify you. I'm happy to have you here joining us. Okay, so infectious agents refers to pathogens. We are going to go a little bit into science. So pardon me, I won't bore you with the terminologies, with the medical jargons. I won't bore you. But at least the ones that are important, just look at it in the surface. Now, infectious agents refer to pathogens, viruses, fungus. Whoever is singing my little boy or my little girl, do us a favor to stop singing. I know you need your mother, but she has to be here too as well. So as we were saying, we have these pathogens. It could be viruses, it could be fungus, it could be parasites that is capable of causing an infection. Examples include maybe influenza viruses. We have viruses that cause influenza. We have bacteria that spread that cause one thing or the other. So these are the infectious agents. That's agent, the things that actually causes this infection, the agents. Now we want to look at the next ball, which is the reservoir. What is this reservoir? Now the reservoir is the habitat. We all know what habitat is: a living place, a place where someone lives, where animals live, or parasites or viruses live. So the reservoir is the habitat where these infectious agents live and multiply. In healthcare settings, common reservoirs can include the human body. Now, in healthcare settings, this reservoir has to be the human body, because when this infectious diseases, these agents now have contact, they have a way of getting into the human body as a reservoir. It results in so many things. It can pass through your skin. It can affect the respiratory tract. It can affect your gastrointestinal system, your intestine. Contaminate equipment or surfaces. It could just move anywhere. Even if it doesn't get into your body, the surfaces, the door handles, the things you do without following the normal process of the hygiene procedures, get these things to easily penetrate. So the reservoir is actually where they stay to multiply. When they get to that place, they begin to spread, they begin to increase, and before you know it is something else. So now let's look at portal of exit. We've looked at the agents themselves, where they stay, their habitat, then the portal of agents, of exit, I beg your pardon, the portal of exit. Now, this is the way the infectious agent leaves the reservoir. How does it go out of the reservoir? It could be through coughing. If it has gotten into your system, when you cough, it could be through coughing, it could be through sneezing, it could be through bleeding or other bodily functions. Very easy, portal of exit. So when you cough it out, and you cough in a manner that you don't follow the cough etiquette, you don't use the proper way of coughing. Maybe you cough into your hand and you use that hand and touch someone else, or you use that hand and do something else for someone. Before you know, that person easily gets a contact that particular flu that you have. The person begins sneezing. So portal of exit. Okay, mode of transmission. We have mode of transmission that refers to how this infectious agent is transferred from the reservoir to a new host. That is the mode of transmission. How? Like we already talked about, a portal of exit, how it comes out. Mode of transmission is almost the same thing: coughing, sneezing, or airborne transmission. We have airborne diseases. Of course, you know that are in the air. They are in the air. So if it is in the air, another person easily contacts it. Then we have the portal of entry. This is how it enters the new host. Where does it enter? Where does it pass through? what is the way with which it enters to a new host? That's to another person. You understand? It can enter through your respiratory system or broken skin. Maybe you have a skin that is broken. You have a broken skin, or you have through your mucous membranes. There are so many ways. These are really a little bit delving into the medical terminologies. But it is important that we know, because if we know, it helps us to stay safe. That's the main idea of all this. It helps us to remain safe in as much as we are doing our duties, are doing our jobs as caregivers. We still ensure that we still remain in the safe terrain. So now, this is just an overview of what we have already talked about in slide 1 to slide 5. Now, a caregiver is infected with the flu but has no symptoms. It is not every time, or it's not in every instance or in every occasion that you and I agree that there are some illnesses that someone has that you don't see the symptoms, you don't get to, that it can stay for a while, it can stay for a long time before you actually know that there's something wrong with you. So let's look at this illustration, because I'm going to be asking 1 or 2 persons. I know we have some, we have a very distinguished professionals on this platform. And as it is my tradition, I like to ask questions. If you know, I like the lesson to be interactive. I just didn't want to start it that way because network was trying to play games with us. So, but we have to move. All right, so a caregiver is infected with flu that has no symptoms. They cough into their hands, like we already have here, before helping a resident with personal care. Now the flu is transferred to the resident's hand. The resident then touches their own face, and the flu enters their body through the mucous membrane in their nose. They have not gotten their annual vaccine. The virus grows and multiplies. The chain of infection has led the infectious disease from one person to another. Now, the resident may now go on to infect. What specific actions could the caregiver or the resident do to break this chain of infection? That is this question I want to ask. I'm directing it to anyone, to anybody on the platform. We may have medical people here too. So let's see. Let's just briefly, in just a few seconds, see how to answer that. With everything we have talked about, what specific actions do you think the caregiver or the residents can do to break that chain of infection? Who is going to help us, please? Anybody?
Please, Ma, can you repeat the question?
Okay, I'm saying that, I'm going to take it again. I'm saying that, like, we can all see my screen. So a caregiver is infected with flu but has no symptoms, and they cough into their hands before helping a resident with personal care. Now, the flu virus is transmitted to the resident's hand from the cough that the caregiver coughed to the resident's hand. The resident now touches their own face, and the flu virus enters their body through the mucous membranes in their nose. They have not gotten their annual flu vaccine, so the virus grows and multiplies. That's chain of infection. So this chain of infection has led the infectious disease from one person to another, from the caregiver to the resident. Now, the residents may now go on to infect other residents and other caregivers. What specific actions could the caregiver or the resident do to break the chain of infection? What can they do to break this chain of infection?
After they have been infected?
No, not after they have been infected.
To avoid this?
That's what yes, to avoid it. That's to avoid it from continuing. You know, it's a chain now, because the caregiver has been infected, and then the resident too, through the caregiver has been infected. So how can they nip it in the bud? How can they save the situation or salvage the situation from other people getting infected? That's what I'm trying to say. It's just something I want us to ponder on. We have nurses here on this platform. So
I feel there should be isolation first.
Okay. Isolate the infected person. Okay. Someone has said.
People that are involved should open up and get isolated. It usually helps in breaking the chain.
Thank you so much, like we do for COVID-19 and others. Thank you so much for that response, Nwachukwu. Who answered? Okay, yes. So who is willing to? Does someone else have something to say? Okay,
okay,
Mr. Kings, please go ahead, sir.
Okay, good evening.
Good evening.
I think in addition to the isolation, they should all try to get antiviral medication.
Okay, thank you, sir.
Yeah.
Good evening, everyone.
Good evening. Good evening. Thank you, Mr. Kingsley. Please go ahead. Who wants to respond?
Good evening, everyone.
Good evening. Go ahead.
Isolation will not come up this time because it's before they got infected. So the nurse should maintain a good coughing exercise. She should follow the procedure for coughing, like we are told that we should cough on our elbow. Then she should wash her hands before taking care of any resident. Then the resident should be taught not to poke her nose and to make sure she wash her hand before she touch her face. And by so doing, the nurse will not infect the residents and the residents will not contact the infection.
Okay, thank you so much. I think, okay.
Your colleague,
Hello.
if they're big and they're infected, will you go near them?
Okay, let's I think we are having two sites now. Let me clear the air. Let me clear the air.
Yes.
We are having two sites. Now, this is what I mean. The caregiver already has flu and does not know, has no symptoms. Now, in the process of her doing her job, she infects the resident. The caregiver infects the resident. Now, the flu virus is transferred to the resident's hand, and then the resident touches their own face and the flu enters their body through the. Now, they have not gotten their vaccine, so this virus grows and multiplies. Now, there is a chain of infection because if something is not done, that we are all both correct. All the answers are actually correct. One, it depends on the kind of infection. If it is a serious infection, isolation is the best thing to do because when that person is isolated, it will cut that chain. It will not make the person to infect other people. Now, the other side, why I said everybody is correct is that the other side, too, if that caregiver continues in terms of maybe having a flu, like we said here, if the caregiver continues to do his or her job with reckless abandon without understanding the implication of what he or she is doing, she can continue to affect other people. But if she takes precautionary measures, that's using her nose mask, washing her hands, doing all the things she needs to do, it will help to nip that problem in the bud. She would not spread, it won't spread to the other people. So now you can see that from that, it's either before or after. Everything you people have said is correct. It's centered around, they are all correct answers, depending on when and how that's the point, that particular infection, if it has spread or if the person is just having it. So I can see 7999653. I don't know who that person is. Maybe you tell us your name because I'm finding it difficult to know who you are. Please go ahead, madam or sir. Seven 99653. Okay. Maybe she's not ready to talk yet. I don't know. I can see that person is a she. All right, Aisha Ismail, I can see that your mic is, you want to say something?
No.
Okay, so you should put off your mic for us, please. Thank you.
All right.
All right, so let's continue. I don't know if that's okay. Let's get to standard precautions. Good. This is where I want us to delve a little because as caregivers, it is very, very important for us to take this particular aspect seriously for our health's sake, for us to remain healthy and remain well. You know, as a caregiver, your job is to break the chain of infection. So understanding and following standard precautions will protect you and the people you care for. It's very important. Now, let's look at some of these standard precautions. We have the hand hygiene. We cannot overemphasize the importance of proper hand washing, not just hand washing, but proper hand washing, because over time, people take that, people show a laxity. People don't really take it seriously. I know where I work, I used to have people when that COVID-19 came in and people were like, wash your hands, do like this, do like that. There were people that didn't take it seriously. They thought that it was just a normal roller coaster, normal, there's nothing there. They're just doing this and just doing that, a whole lot. So, but they forgot that it was very, very important. Proper hand washing, not just washing your hands, but washing it properly is important. Like I told you that this caregiving training is practically filled with, how do I put it? That's the practical aspect of it. We don't take it, we don't joke with it at all. We are going to have the practicals, like I said. And like I also said, our practicals is as good as you being physically around. You will get to see it when the time comes. You will understand. So we are going to learn most of the things we are going to do today. I am just running through the theoretical aspect because as the practical is important, so is the theoretical aspect. You could be asked one or two questions and you have to answer, without showing the practical aspect. So that is why I said not only delving into the practicals, let's have the theoretical aspect of it so that you can go back and study and it can help you. But most of these things, we are going to have them practicalized. You would see them. You can ask your questions. You can interact. And we also want to learn from you as well because we have professionals on this platform too. So hand hygiene is very important. Washing your hands, very, very important. We are going to see the proper way of washing hands, not just to wash your hands anyhow and you move. As a caregiver, people want to see how best you can do your job. As a caregiver, you should be in the right place to correct others that don't actually know what they are doing or how to go about what they are doing. So hand hygiene is important that we wash our hands with soap and water, or we can use alcohol-based hand rub. We have so many alcohol-based sanitizers and hand rub that you can use. But besides that, it is important to note that the hand washing your hands is the best form. You can only use hand rub or when you know that your hands are clean and you just use it on your hands. Yes, but the most important thing is to wash your hands. That's it. That's the main thing. Do not get tired of washing your hands. Don't say, oh, my hands are clean. Of course not, because you cannot see the germs. You cannot see them with your naked eye. So how do you know that your hands are clean? So these are some of the things that we have to understand. Use appropriate personal protective equipment. I can see the 799653, your hand is still up. I wonder why. I don't understand. I asked if you had a question, but no comment. So I don't know why your hand is up. But if you're having any challenge, please just do put it in the chat box for me. I'll see it. Okay, so PPE refers to personal protective equipment like your hand gloves, your mask, respirators, your gowns, the things you wear to protect yourself, personal protective equipment. That is PPE. It is important that every caregiver, you must make sure that you know how to use your PPE, you know how to remove it properly. That's another very important aspect because it's very easy for us to get germs, for you to be infected, very easy for people to be infected. But if you follow the standard precautions, every organization, they have their own precautions and the way they go about this thing. So if you follow, it's very, very easy for you to stay away, to stay free from infecting someone or get infected yourself. Now, sharp two is another thing. How do you discard your materials, sharps, the things you use? How do you discard them? You just keep them lying carelessly? Of course not. If you are using maybe anything that has got to do with maybe razor blade or maybe scissors or anything like that, ensure that it is disposed properly. That is very important. Ensure that it is disposed properly. Don't just keep it anywhere, to just lie there carelessly anywhere. No, Your syringes, needles. I know we are not supposed, caregivers, you are not supposed at any point to give injections. You are not supposed to give injections to people except you are under nurse delegation. There's something they call nurse delegation. When we get there, it's one of our modules. When we get there, you see that even as a caregiver, if a nurse delegates a particular duty to you, after due observation and also training that you have the skills and you have the right training to do a particular thing, the nurse can delegate a duty, a particular duty to you. So that is nurse delegation, but we'll get there when we get there. So, but ordinarily, we are not supposed to give injections. You are not supposed to give medications. You are not supposed to administer anything that has got to do with sterile dressing as a caregiver. It's important to note that because so many things are going on in the internet. I must say that I actually practically saw something on the internet where they had a caregiving training and people were shown how to administer injection. People were shown how to give insulin injection. People were shown how to do a whole lot of things. And I was like, oh, wow, this is serious because you are not supposed to do that. And since you are going to pass through an examination, take for instance, you are given an exam and you are asked as a caregiver, all of the following are your duties except, and they put all those things, giving injection or insulin injection or administering medication, and you go and circle that or you go and give that, obviously you are wrong. So it's important that, like we talked about, caregiving givers' responsibilities and duties. We said that last week when we had the training. So it's important we know our duties. So if you have to deal with needles, maybe blades, and maybe other sharp items that can puncture your skin and expose you to bloodborne pathogens, to diseases that could get in contact with your blood, please dispose them properly. It's very important. Keep injections properly. They are under nurse delegation. Clean and sterilize instruments and devices. Clean and disinfect the environment. These are things that you must. Please don't be tired of doing them. It is very important. Don't be tired of doing them because I've been in a care setting and I have seen that I've seen a couple of someone is trying to interact. Okay, thank you. Thank you, MJB, for giving me the opportunity to mute. It makes our job easier so that anybody that gives us stress, we just mute. So as I was saying, now, hand hygiene, like we talked about, cleaning your hands by washing it with soap, with water, alcohol-based hand rub. And also, like we said, the Center for Disease Control estimates that 2 million care recipients get an infection from healthcare providers every year. You can see why I emphasize, why I'm still saying that as caregivers, we have to be very careful because we deal directly with people that are frail, people that are fragile, people that most of them have a weak immune system. So we have to be careful to ensure that we take standard precautions in any of those things that we do in our duties, in the line of our duties, so that we don't infect our clients. Now, for instance, like I said, germs, you cannot see germs with your naked eyes. Like that hand you are seeing, you can see the hand. With our 2 eyes, you can see the hand stretched out there, that the hand looks clean. Anybody would say, like a child would say, oh, my hands are clean. Of course, the hands look clean, but look at the other picture. You cannot imagine that all those germs you are seeing on the other hand are actually on this hand that are not visible. So it is important that we note, we take hand washing very seriously. You don't have to be a caregiver to take hand washing seriously. Even in our homes, we should inculcate it into our children. We should inculcate it in the office. You can talk to people that don't know because knowledge is very important. And if knowledge is expensive, you just try ignorance and see. You see that having the right knowledge is good because you can educate those that don't know. So even in your workplaces, anywhere you find yourself, it's important to wash your hands because the fastest way we can contact infection is through dirty hands. It's as fast because you sneeze and you don't follow the etiquette, you sneeze, you cough, you do all those things without following the proper way of doing them, you easily get infection. And you can easily spread it to people because of by virtue of the job that you do or that we do. So clean your hands at the following times. Now, these are times that you need to clean your hands. Very, very important. When do you need to keep your hands clean? You need to wash your hands or you need to clean your hands at the following times. Upon arriving at work, I tell people that maybe people that are professional caregivers, maybe before you arrive at the house of your clients, You wash your hands. I like some houses that have their guest toilets outside the house. I don't have, but in some houses, you find out that there is a toilet for maybe the guest outside, you know, so you wash your hands before you even enter the house. Outside, as you come as a caregiver, if you have such, even if you don't have, you can call for water to be brought to you. You wash your hands, or you get to the tap and wash your hands very well before you enter a residence room, apartment, or you provide any hands-on residential care or care that you want to give. After removing your hand gloves, before putting on your gloves, and after removing your gloves, before leaving a residence room or apartment, after providing hands-on care, wash your hands. Oh, washing hands is something that you just have to do. It's something that you don't even have to have any specific, just keep doing it. Just keep washing your hands. It's for your own good so that you don't get infected. Thank God, we are going to also learn, aside the hand hygiene, we'll learn the proper way of donning and doffing gloves, your hand gloves, how the proper way of wearing them without infecting, that's contacting infection, because you are using the outward part of the gloves. And so you have to remove it properly so that you don't get stained or you don't spread infection. So we are going to see it when we are having the practical session. Most of these things, like I'm saying, and I'm still emphasizing, we are going to have them when we are doing the practicals. All the skills that are necessary for caregiving, for a caregiver to function effectively, we have taken time. BCC UK, they are good for doing this training. We've taken time to pull them out, all the skills out, and make sure that you see firsthand how it is done and you understand. If you have questions, you ask. So now, after using the restroom, after blowing your nose, after petting or touching animals before leaving work at the end of your shift, summarily, thank God you have the slides like I promised last week, and I gave this week too. At the end of tomorrow's class, we are going to have the slides for this week, for the 2 days, and possibly the recording as well. So let's move, because we just have to move. So there's an acronym that is SWIPES, SWIPES. It is called, it is SWIPES. Now, this acronym, they all stand for different things in this particular setting. It also means another thing in another setting, but in this one, now, what does it mean? This SWIPES tells you, you can have an overview of what is expected of you in the line of your duty. That is why I had to bring this out. Now, S is for what? Gather supplies before starting a task. Before you do any task, gather your supplies. Ensure that your things are ready. You don't remember, oh, I need to go and get this when you have started. No, if you are giving a client maybe a bed bath, a client that is bed bound, you are giving the client that cannot maybe go to the bathroom to take his bath or have bath due to the illness or something, then you want to give the person a bed bath. How do you do it? Make sure that your supplies, everything you need, the basin, the water, everything is at proximity. Not that when you start, you now remember another thing you are going, so you remember this one you are going. No. So SWIPES as S is for supplies. Gather your supplies before you start any task, anything you are about to do. Let your brain walk around the clock. These are the things that I need to use. Okay, gather them. It's just like a woman that wants to cook. Most people, when they want to cook, like we women, you want to cook, you ensure that you gather the things that you need at proximity. Especially if you have to run a video, you are doing a video concerning what you are preparing, you have all those things around you. You will not say, oh, it's time to put a salt, and you are going to look for where the salt container is, or it's time to do this, you are going to do this. No. So that's how it is for caregiving. Any task that you want to actually perform, ensure that your materials are handy. Now, wash your hands before contact with the clients. That we have talked about already. Before you do anything with the clients, please wash your hands thoroughly in the proper manner. Then identify yourself by telling your clients, the clients your name. This is important. Many people fail caregiving tests. I must stress this part. Fail it because when they are asked, this is part of the questions, they are asked, you know, and they are expected, or they ask you to have a practical. Just show us maybe a 2 minutes practical of how you can do carry out a particular skill. And then on a person, and maybe a person is kept there and you are asked to just mock present, maybe just show the practical skills. And you don't know, you keep doing it. Yes, you know how to do everything, but you forget this particular aspect that carries a high mark, I must tell you. And what is that aspect? Identify yourself by telling the client your name. Very important. Two things are most important. Identify when you walk into any room, even if you are entering there 10 times in maybe just 5 minutes, you're entering there 10 times in 5 minutes. Keep identifying yourself. Let the clients know, like those of us that were here the first 2 days, and not only those, even Jovita that I had to send the video to and the slides. So I believe she has done justice to them all. So you see that there is a video there that would really help you when you go through, when you watch the video. You are going to see what I'm talking about. Explain to the clients what you are doing at all times. Oh, I need to just turn you around so that I'll be able to do it. Would that be okay? And hear from the clients. The clients will say, yes, that's fine. Or the clients will nod in the affirmative. So you know that, okay, never you do anything on anybody without explaining what you want to do as a caregiver. That's something that costs people a lot of money. They'll just move and continue to do what they are doing. They are showing that, yes, they have the practical skills, but they are not talking. They are not communicating, which is one very important skill of a caregiver. You understand? So scan the area too to be sure everything is back in place after the task is done. When you are done, scan the area, make sure there's nothing lying carelessly. There's nothing that the client can stumble and fall. There's nothing that is inappropriately kept. Make sure that all these things go with you. If you follow this acronym, you take them, at least it will go a long way in helping you, even when you have to take any test or you are doing rendering unpaid caregiving, like you're not into the paid job, you're just doing for a family member or so. Then, like I said, this caregiving is not only for those that may wish to use it to become professional caregivers. It is for everybody. It is for everybody. It's just a training that you can gift anybody. You can give at the end of the person has a certificate, yes, but you can gift anybody to have the skills, because we are having the age population really skyrocket. And at any point in time, you are either going to be a caregiver or you will need a caregiver. And if you need a caregiver that doesn't really know his or her onions, doesn't really know what to do, because you have the knowledge, you can assist. You can say, okay, this is how I want this to be done. This is what I want you to do on me. So caregiving, it's just round. There is no way at any a point in your life that you will not need a caregiver or you yourself be a caregiver. So it's not really about those that actually want to be professionals. It's also for those that wish to have the knowledge. So these are practically the things that we need to know as we progress. So at this point, like, you know me, those that know me, I don't like talking to myself. I'd like to ask, because it is an illness when you talk to yourself and you don't even know that you are talking to yourself. And you know, it happens most times. There's one time I actually did a training and I didn't know network had gone. Network had left me and I was busy talking to myself. By the time I realized, it became like an illness. So I need to know, are we together? Are we following, please? Can everyone hear me?
Yes,
Loud
ma'am.
and
I can hear
Yes,
you.
ma'am. Can
Yes.
hear you, ma'am.
Okay.
Yes, ma'am.
All right, thank you. So that I know I'm not.
Yes.
So let's go ahead. Now, steps in washing your hands. This is just for you to just view. Like I said, we are going to have the practical demonstrations of all the skills that you need. Any caregiver that passes through BCC UK and you remain the same, like you don't have a paradigm shift in your life, then it means there's something definitely wrong. So we'll take time to explore, show you how to properly wash hands, the steps that are necessary and how to go about it. So this is just a pictorial representation of what we're going to do in the practicals. Now we have the alcohol-based hand rub too that you can use for yourself. Okay, to clean your hands and maybe to sanitize your hands. Then wearing gloves too. You must use gloves. This is important. Gloves is a nurse's best friend. Like they used to say, it's a nurse best friend. And we are health practitioners, not only nurses. For all health practitioners, your hand gloves should be your best friend. Wear it at all times when you need to do anything. It is very easy. That's why it's important that we learn the skill of how to properly wear our hand gloves and how to remove them as well. They are very important. So you must wear gloves at this times, especially at this times. You must wear gloves when you have direct contact with blood, body fluids, or mucous membranes, maybe like catarrh openings like that. You have to have your hand gloves. Now, also when you need to handle things contaminated with germs, like tissues, like disposable undergarments, you know, as a caregiver, when you have your PPE and you want to dispose of it, you have to also be careful because the outward part has come in contact with your client, has perhaps come in contact with fluid or come in contact with something. So when you are removing it, you remove it in such a way that we have techniques to do this thing that we would learn when we have the practicals next week, God willing. We are going to see the 2 days we have, we are going to dissect. In fact, we'll operate and dissect all the practicals that we need, and everybody has to learn how to do it. So that even in the midnight, there is an emergency or you need this, someone needs your caregiving services, you are good to go. You don't waste time. That's why knowledge is good. So, and when you are providing first aid as well, you clean up bodily fluids, you do all those things, or you assist a client with toileting. We are going to get toileting assistance in one of our modules, I think tomorrow, by God willing. So we are going to see all those things. These are times that we must and should wear our hand gloves. Proper glove use too, I've said that we are going to learn how to do that practically. This is just the theoretical aspect. So we have different types of gloves. We have the latex gloves. We have the sterile gloves. We have so many types of gloves. So we will also see the types when we get there. We'll definitely. So this one, who is doing that to us again? Please beg that person not to disrupt us. So now, putting on gloves too, excuse me, we are going to see the proper way of putting on gloves, how to wear gloves, and how to remove gloves, because they are effective protection if they are used correctly. Now, these gloves are, it's just like fire. If you use fire well, you know that we cannot cook without fire. Fire is very good, but you know that fire, if not used properly, you know the hazard, you know the adverse effect of fire, what it can do to us. So gloves is like that. If you wear it properly at all times, it will be your best friend. It will help you to. But if you don't wear it properly, if you don't know how to wear it and to remove it, you are just going to be like pouring oil on the surface of water, because it will not help you. So that's why it's important for us to learn that particular skills when we would have it practically showcased. So for you to have it, because I like to have most of these things on slides so that you can get back to them. These are the steps like we are having here. These are practically the steps that we need to follow when we are wearing gloves, how to remove, how to wear. We are going to see it. Okay. All right. Then use of personal protective equipment too, like gowns, like aprons, keeping your clothing and your skins clean to prevent accidentally spreading germs to others. Important. I cannot, like, people that know me, like when we started last week, the people on the platform can attest to the fact that I like stressing certain things. And when I stress certain things, it's important to note that the emphasis is for you to know that it is important. Things that are important are always emphasized in all aspects of our lives. So your gloves, your personal protective equipment, everything you need, protect yourself. Oh, I must not overemphasize that. Protect yourself at all times so that you don't get, because you are health practitioners, healthcare practitioners. So you deal with people that any kind of person with any kind of illness or anything. So you have to protect yourself and to stay safe, because the more caregivers we have, better it will be for people. So we wouldn't want anything to happen. So it's important. How you remove your PPE is also important. How you wear it is also important. We are going to see it to avoid the spread of infection. When you remove gloves, discard them. When you remove your gloves, put them in the litter bin, put them in the refuse, just discard them. Your gowns, everything, discard them. Leave the client's room, perform your hand hygiene, remove your face shield if you are wearing one, or your goggles, remove and discard your mask, perform your hand hygiene at all times, anytime you leave any client's room, or at the end of you performing any duty. So let's look at respiratory hygiene and cough etiquette too. Like we talked about, we are going to see the cough etiquette. Cover your mouth and your nose with a tissue when coughing or sneezing. Dispose of the tissue in the nearest waste container. Now, if you, some years ago, I used to, before I joined, like I said, I am a member of International Red Cross Society. So I'm a person that has many parts. So one of the trainings we went to schools to give some trainings, first aid training, CPR and first aid. And so we told them, in the course of doing that, we saw a girl that's coughed. She sneezed rather. She sneezed into her palm, like, oh, she wanted to sneeze and she didn't know, she tried to bottle it up, but she sneezed into her palm, you know. So though that was not what we actually went that day to do, but because we observed that, we had to tell them that it is wrong for you to sneeze into your palm. It is very wrong. Rather, you sneeze. We are going to seek sneezing and coughing etiquette. It's also a practical skill for caregivers. So instead, you sneeze into your elbow instead of your hands. You just cough your elbow. Do as if you are giving, those of us that are mathematicians, do as if you are making the greater than sign, which is your right hand. When you want to do greater than your right hand, less than your left hand. So it's either you do the greater than sign, you cough into your elbow, or you do the less than sign. Some of us that have forgotten, please, you can ask your children, because I know some of our children are sitting sign. Because some of us may have forgotten. So that's another thing. Those sharps, we talked about it, your sharp safety. How do you discard them? These are things that are important. Now, some of these things are things that the risk of infection is very, but you must know how to properly handle sharps to protect yourself and others. Nurses know this and relate to this more. Know your potential exposure. This is one of those things. Be aware of where you might find needles or other sharps in your workplace. That's your potential exposures. Like if you're a surgical nurse, you know those things that you are potentially going to see around your vicinity, around your environment where you work. Know your potential exposure. For example, if you support a client who takes insulin injections, check for needles before reaching into a pile of laundry. That is to say, if you are walking around someone or somewhere that they are handling a patient that takes insulin injections, and you are going to empty the litter bin, be careful, because you know that definitely you are going to find some needles or some syringes, you know. Check for needles before reaching into a pile of laundry. Maybe their clothes, laundry materials, check, because mistakenly these things happen by mistake, really. So know your potential exposure. Sharp safety devices too. There are devices like you can see here that are sharp safety devices. They come with built-in safety devices such as retractable needles or plastic caps. There are some of these materials. Most of these homes we go for caregiving or residential facilities. We have such sharp safety disposal materials around. If you don't know where to dispose of a particular thing, ask your employer. Ask your employer or ask your supervisor. In all those care homes, they tell us exactly how to go about doing these things. At any point, anybody, like I said last week, anybody that does not ask, that asks questions rather, will not lose his way, will not miss his way. That is what. So if you ask questions, even when you find yourself in a strange place where you have you are stuck one way or the other, please don't hesitate. Ask questions so you do the right thing. It's better that doing the right thing than saying sorry after. So picking up the discarded syringes, to put on puncture-resistant gloves when you are picking these things. Use puncture-resistant gloves. There are specific kinds of gloves that you can't easily pierce. It's resistant to any punctures. Things cannot just. And do not touch the syringe with your hands. If you want to pick up maybe discarded syringes, don't touch it with your bare hands. You understand? And after that, remove your gloves. After doing all those kind of duties, remove your gloves and discard of them properly. Now, cleaning and disinfecting the environment. This is another important thing. Clean and disinfect surfaces contaminated with body fluid or blood immediately. Maybe in the course of doing something, maybe handling your clients, maybe he throws up, you know, or maybe there is fluid somewhere, blood or something. Please quickly disinfect the surface. Don't waste time. Disinfect that place. You can use a whole lot of disinfectants that are around, you know, that you can use. You know, you can use a bleach solution or a commercial household cleaning solution that kills additional germs. Disinfect the environment. Scrub, remove all the germs. It is very, very important for us to note that. Always wear gloves while cleaning contaminated surfaces. Use paper towels to clean up. So all these things are things that we need to know. When we have the practicals, they are just theoretical aspects so that you just have an overview. By the time you are doing the practicals, do not be too much work again or talking. You just align it with what or it would be aligned rather. We would just align it to the theoretical aspect we already are talking about. So items such as used sheets, dirty dishes, worn clothes, all these are items that we have to, discard properly. We have to ensure that they are disinfected, they are kept clean to avoid the spread of infection. Remember, we are still talking about infection. Strengthening the immune system. As caregivers and also as people that are handling frail people, there are things that we need to know. As we age, our immune systems become less effective at fighting infections. That's what I want us to understand. Now, the following factors also have a negative effect on the immune system. So there are things also, aside aging, there are certain things that, excuse me, that affect our immune system, like poor nutrition. If you don't eat well, so it is important that you as a caregiver, you have to eat well, balanced diet to get food and nutrition, nutritional food and nutrition. I think one of the slides, so you will understand. It's also tomorrow we have that. So it's important that as caregivers, you need to eat, you need to ensure that you are sound, eat and be strong and be healthy so that you're able to carry out the task that's ahead of you. Make healthy choices in diet, your fluid intake, drink water, drink lots of water to avoid dehydration. Reducing stress too is important for you. Reduce stress, get vaccinations, visit a doctor regularly. As a caregiver, visit a doctor regularly. Don't wait until you have symptoms. Go for checkup. Go for checkup so that you know that you are fit. There's nothing wrong with you. Like your health, you are healthy to do the task, carry out the task that is ahead of you. And don't miss your vaccinations. If you have vaccinations, don't miss it. In as much as you also encourage your clients or your clients that needs your care to also get vaccinated when the need arises. Also ensure that you don't skip your vaccination. That's very, very important for you. Make healthy choices for yourself and encourage your clients to do the same to prevent infection. This is very important. Do exercises. Well, we'll get to self-care for caregivers. So let me not overflow that. When we get there, you see that caregivers too really need to take care of themselves to stay fit. So now let's look at vaccines and immunizations. Vaccines and immunizations. Most of us take vaccines. And now I have been talking too much, which I don't like. I know we are following and obviously maybe we are enjoying it. But now I'd like to stop. I'd like to pause. Okay, Jovita, nice to have you. I can see Jovita very clear now. So, and I'm happy to see you, Jovita, here now because I know. Okay. Thank you. So
to be visible.
Okay, that's beautiful. You're welcome. It's nice to have you.
Thank you.
So I would like to ask mothers now. Let's talk.
Hello.
Pardon?
Good evening, ma. Can you hear me?
Good evening. I can hear you.
Echo, I don't know for my own, just don't be offended. I don't know whether you can always, because I use my phone and sometimes I struggle to see if you can be putting it in a presentation mode so that it will come out clearly from our own end. Just a suggestion, please.
Okay. Presentation mode.
Yes, exactly. That place, it will come out clearly.
All right. Let's see, Is that better?
Yes, better. Yes.
Okay. All right. So I was asking that mothers on this platform should tell us what are some of the vaccines and immunizations that are important for us. Let me not do that one because already I've been talking and talking. So I need opinions. I need us to talk a little. So what are some of those vaccines and immunizations that is necessary or important? I think we have nurses. If we have nurses, please speak up. Tell us what are some of the immunizations or vaccines that are important for healthy living, not only for people that are ill, but for everybody who is ready to help us.
One of them is the hepatitis vaccine. and of course, hepatitis and
Okay.
no
one is not even allowed. Dio. Okay, ma'am, please go ahead.
Hepatitis vaccine and COVID-19 vaccines are also very important.
Thank you. Thank you. Thank you so much. Thank you. It's nice to hear your voice. To me, I've been hearing your voice. I want to hear other people's voices. Let them also make me happy. Thank you. Thank you for the response. So we have hepatitis B and others as well, even the COVID-19 vaccine that people were asked to take. So practically, healthcare workers should stay current on their vaccines. As caregivers, please stay current on your vaccines. Stay vaccinated, take your immunizations so that you can avoid spreading some or get affected by certain illnesses or diseases. Okay. Can we? Okay, so types of immunizations now, like we have here already. Okay, Madam Kusan, sorry. I'm just seeing your hand raised now. I hope you've not been doing that for a long time. Madam Kusan, please, do you have something to say? Good evening.
Yes, good evening, and good evening, everyone.
Good evening.
Mine is actually a question.
Okay.
So looking at immunizations, you know, sometimes you find that immunizations that are given in some certain contexts are not the same immunizations that are given in other contexts. Yes, they are the ones that are common, like hepatitis and for COVID. In a situation whereby you're coming from a country whereby some certain vaccines are necessary, and you're going to be a caregiver in a country that some certain vaccines that you have taken are not necessary. How do you mitigate such instances?
Okay. If I understood what you just said, Madam Kusan, what you are saying is maybe you have taken some vaccinations from where you were, and you are moving somewhere else, or you are somewhere else as a caregiver, and you need to, then you now discover that vaccinations that you took are not really necessary in that particular environment or in that instance. What do you do? Am I correct? I don't know if I am right.
Yes, ma'am.
Okay.
Yes,
okay,
ma'am.
Fine. So in such situations now, in every caregiving setting, at least 90%, I know, if you are not a personal caregiver, what I mean by personal caregiver is maybe you are working with just an employer, and maybe someone employs you, come and of my aged mother, or someone that needs you, or someone with disability. If you are working in a care home or in a care environment, now, by the time you are eventually expected to start working there, maybe you move from where you went to another place, and you have just gotten a job to work there as a caregiver. There are immunizations and there are vaccinations that are statutory. I don't know whether statutory is the right word, but they are important that you must have. It's one of the conditions that you must have before you work there. At least 80% of care homes that I know. What am I trying to say? Even if you have taken the immunizations, the vaccinations that you have taken, realizing that it's not necessary, there's nothing you can do because you have already taken them. But it is important that in that country you are, and in that your duty as a caregiver, it is important based on their policies that there are certain vaccinations or immunizations that are mandatory that you need to take, that you have to take. One of their policies there, at least in most of the care homes that I know, not 80% of them. So eventually it means you still have to disregard that and take the immunizations or the vaccinations that are related to what you do or are relevant to your profession as a caregiver in that particular area. So that is what I think, don't know if to the best of my knowledge, if I've been able to answer your question, Madam San.
Yes, you have. Thank you so much.
Okay, I don't know if I have, but in my own little knowledge, that is what is obtainable. I understand perfectly what you are trying to say, because different cultures, different policies, when you move out there, you get to face a new one. So when you face that one, for you to be able, because it's one of the things, most of the care homes is their policy. You have to ensure that they test you for HIV. They do a whole lot of tests to ensure that they know that you know all these things first before you even start. So it is important that if you have not seen the vaccinations that are important before actually starting that job, then you have to do it. Thank you. So let's move to the next one. So bloodborne pathogens. We have bloodborne pathogens. Now, as caregivers, you come in contact with client's blood or bodily fluids, like I already said. So you present a small risk of exposure to bloodborne pathogens. Why do we say small risk? Why do we say small risk? Because you are not actively involved in, you don't do any major thing that involves, and you don't do surgical operation, you don't do any major thing that you directly get in contact with the blood. That's why it's small. By virtue of the fact that you are a caregiver, you are not a nurse, you are not a doctor, there's an extent to which you go. But that notwithstanding, because you still have some level of risk of exposure to these bloodborne pathogens, it is important that you understand how they are spread and understand what to do at such a situation. So let's look at some examples of these bloodborne pathogens. We have the hepatitis B that we already talked about, HBV, and that's a viral infection that infects the liver. Very, very bad infection. Then we have hepatitis C. We have the HIV that we already know that attacks the body's immune system. Now, if a person with HIV does not receive treatment, it gets to full-blown AIDS. The first stage is the HIV. Then if the person leaves it, just relaxes and say, okay, whatever, I'm not taking my drugs. The next thing gets to full-blown AIDS. So ways that blood pathogens actually spread. Helping a client who is bleeding and gets infected, a needle or punctured wound, changing of linens that are contaminated. You come in contact with mucous membrane, maybe like from the mouth, from the nose, from the eyes, all those discharges that come out. It becomes a problem because you can easily come in contact with these blood pathogens. Now, HIV/AIDS. HIV/AIDS. This is one of the pathogens, blood pathogens. Now, HIV, if a person that has HIV, like I said before, does not receive treatment, they can develop AIDS. So untreated HIV typically progresses through 3 stages. And like I told you, I'm just going to, this is important for the theoretical aspect. They're not actually medical doctors, but it is important for us to know, because when you know, you can stay safe. When you know, what you don't know, it's not very good. It's better you know. So we look at the stages, the acute HIV, we have the chronic HIV, and then we have the full-blown AIDS, which is the acquired immune deficiency syndrome, AIDS. So now, HIV is transmitted through the blood. The reason I'm talking about HIV is that this is also very, very common. We find out that most health workers get infected. The rate with which HIV, they get infected. Why? Not through sexual intercourse this time, but through the fact that they use all those things. They lose guard. They don't follow the safety standard precautions that they need to. So HIV can be spread through having unprotected vaginal, anal, or oral sex with the person who already has HIV, or through breast milk too. People that already have that infection can pass the virus to their babies through pregnancy or through childbirth. So breastfeeding too, receiving blood, contaminated blood, if they have to do blood transfusion, you could equally have that if it's not, all the precautions is not taken or are not taken. So you can do tests as caregivers. It is important, like Madam Kusan tried to ask something too. Even if you have had series of HIV tests in every facility, when you get there, before you start working, there are certain things that you have to go through, certain tests, certain procedures. So you have to be tested. One of them is you have to be tested for HIV. That's not to say that if you have HIV, you will not be given a double. No, that's not what I'm saying. Because thank God for sensitization, thank God for the awareness. Now, the stigma attached with HIV is reduced compared to when it initially started. then the stigma was like 100%. Now, thank God, there are certain rules, legal. We have legal luminaries on this platform, so they understand. There are legal side of legal penalties, if I may use that word, for people that you treat or deprive HIV positive people, patients, and maybe you don't give them the things they need or treat them as different from any other normal human being. The law, the full sledgehammer of the law will send on anybody that treats them like that. So now it's important that as caregivers, we have to test yourself, and then even the organization, they test to ensure that you are HIV negative. Even if you are HIV positive, since they know, then because they know, you'll be able to adhere to follow certain instructions, follow certain rules, depending on the facility where you work. Because each institution, each organization, they have their own rules. Many of them may be common, but some may be peculiar to them, special to that particular setting or that particular care home. So follow the protocols. If your employer is a client and you need to test, call your physician to discuss the need for testing. Make sure you test. Gone are the days that people are afraid to know their HIV status. That early time, you see that many people that have died and have lost their lives is because they did not want to test, scared of being said they had HIV. That. So, but now people are living with HIV/AIDS. They're coming out. The stigmatization the stigma is reduced, and excuse me, and so on and so forth. The stigma is reduced, so people are not afraid to come out and disclose their status. Like they are not afraid to come and say, "Oh, I have HIV," or that and that. So, caregivers, as we know, caregivers experience isolation. You know how they know that you are you know how society is.
Roma, you're breaking up.
Okay, sorry. Thank God, network has been so nice to us since it has. I was so happy that our prayers have been answered, but I don't know what just happened. Sorry, I have to move it.
It's back.
It has just taken. Yeah, it has taken us away. So let's get back to find where we were. So practically, please, can everybody see the screen? When there's a network fluctuation, the screen jumps and goes back.
Yes,
So I guess
we can see
need to know. So stigma. So stigma is something that we have to be very mindful of. I must say that as caregivers, please, for any reason, even if you are attached to someone that has HIV or someone that has AIDS, please, 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 it is temptation. I know, because we can be tempted. We are also human beings as caregivers. But please, at no point should you make the person feel less of a human being. Just like having a disabled person, and maybe you are taking care of a disabled person. I told you that these people are highly sensitive. Anybody that is disabled, anybody that maybe has hearing disability, that's like maybe deaf, I'm not supposed to say deaf, has hearing disability and maybe have speech issues, or people that have one challenge or the other, they are highly sensitive. They can misconstrue your nonverbal expressions. They can misconstrue even your behavior, you know. So that's why you have to be very, very careful. Don't say, this person has HIV/AIDS, and it treats the person less of, make the person feel less of himself or herself. This is very important for us as caregivers. We shouldn't be the ones making that mistake. Always treat people with respect and dignity, regardless of their HIV status. You know, it shouldn't come into the, maintain a client confidentiality, and don't go about like, you know, it is, you are bound to be confidential. Keep your client confidentiality. That's another thing. We said it earlier, the first 2 days. On no account should you say, oh, do you know you move around and keep divulging sensitive information about your clients to other people. Remember, you are a trusted person. Remember, you are a trusted, and also remember that whatever you do is for the well-being of your client. So I don't think that disclosing confidential information will help your client well-being. So do not discuss their HIV status in case you have anything to do with that. You understand? So let's see what we have next. With that, we have actually come to that first module, to the end of it. Remember, like I said, because of time, I really like to give time for people to talk, but I would like, if in case, as I'm talking, you don't understand anything, please and please and please kindly ask questions. Better to know. Okay, someone is asking, okay, Madam Kusan, okay, thank you for that question. For a client with HIV, is the status of the client mentioned to the caregiver? Yes, 100%, yes. 100% yes, Madam Kusan, because you have the service plan. If you have a HIV positive patient, even in your service plan, in your care plan, it is indicated, because you have to also ensure that your client, you have to monitor your client in taking his or her antiretroviral drugs. So there is no way, as a caregiver, you are told exact your client states at the point that you start, because it would help you function better. If you even know that your client, if you were maybe 70% or 80% careful, and you now know that your client has HIV, then you will be 100% careful. So the institution, that's one thing, they make it very, very clear. They tell you HIV, whatever condition your client has, as a caregiver, you have the right to know at all times. Thank you for that question. I'm sure it has helped other people to understand. So now, as much as possible, let us look at mobility. This is another very important thing that we need to know. And I must also tell you that in this topic, we have the practical aspect of it. We have a whole lot to do with the practical aspect of it. So when we are doing practicals, we are going to see it. So it's just going to be a walkthrough so that you have the theoretical knowledge of it. We are going to show you the practicals. We are going to show you what to do if you have a client that is very fat and you have one that is slim, maybe moderate, not too fat, not fat, like I am not fat, even though you have not seen me. So what do you do? How to carry movement, mobility. Mobility has got to do with movement. Okay, so now, mobility, like we know, it's a very, very important aspect of someone's life, of our client's life, of anybody's life. If you cannot move, you know what it means. So assisting a client with mobility is the key to supporting their independence and quality of life. As a caregiver, your duties encompasses, it embraces mobility. So for you to prevent injury to your client and to yourself as a caregiver, you have to understand how to use proper body mechanics and assistive devices when you are performing those duties. It's very important for us to do. What do you do when you are applying, when you are carrying out those duties? You have to help your clients move from one place to another. Maybe your client that has a weak knee, cannot walk far, cannot walk long. What do you do? Important to note. That is why. So to prevent injury to your client and to yourself, this knowledge is very, very important. Like you can see that beautiful woman there with an assistive device helping her to move. Okay, now mobility, like I already said, is an important and essential part of a person's independence. And many factors can make people have issues with mobility. What are these factors? It could be conditions present at birth. It could be maybe birth issues that has affected them even up until then. It could be the result of illness, it could be physical injury, medication, a whole lot of things can affect someone's mobility. You understand? So it's the factors are many. So as a caregiver that you have to handle the mobility aspect of your client, you have to ensure that you know what you are doing, hence this training. Now, body mechanics. Your work as a caregiver includes regularly helping clients move. You help your client to move is physically demanding. Helping a client to move is physically demanding and can cause serious injury. Can cause serious injury to you as a caregiver. Please, let's be very attentive at this point. Now, as a caregiver, maybe you have to lift. Okay, I want to give you a short story. I want to, an illustration, not a story per se. Like, you know, I like to give my life. I like to tell you some things because I've seen the bad, the good, and the ugly. I've seen a whole lot of things. And I know most of us who have also. So, like I talked about my father, when my father was actually bedbound, it was not easy for my mother to do all those things. She was a caregiver. Then she didn't know about caregiving, so she didn't understand. You understand? But now the effect of all those things is telling on her. She now has back pain, and she is very difficult for her to stand up straight. She has waist pain. Severe waist pain. And why? Because then she was not a caregiver. She didn't have the right knowledge. And I too, at that I wasn't into the health field. So I didn't really, there was nothing I could really do. That's why I say knowledge is important in this life. Sometimes people take knowledge for granted. They say, I have to pay. Oh, I don't have money. I don't do that. If knowledge is expensive, try ignorance. Ignorance is far more. Like we were ignorant then. And it cost us. It has cost us something that is even more expensive than us having had that knowledge at that time. So she was always carrying my father, making my father to lean on her shoulder, on her hand, and so much weight because my father was a plumpy person, you know, had weight. So if she needs to move him, if she needs him to eat or anything, he was always leaning the weight on her shoulder, on her back sometimes. So it has actually affected her seriously. Now it's telling on her. So why am I giving you this illustration? I'm trying to tell you that even as a caregiver, you also have to be mindful of yourself. You have to know how to handle your client when it comes to body mechanics, mobility, so that the pressure is not on you. And you don't finish handling your client and not too long after, you are the one needing a caregiver instead of you doing your caregiving. So proper body mechanics and techniques will help you protect your back, your neck, your shoulders, your knees, and your wrists. Very important. As we will do the practical aspect of it, and next week we're going to have the last days filled with practical. We don't have any theory. So the 3-4 hours, about 10 hours, 7 or 8 hours, we are going to use them to do all the, because practical is the main thing in caregiving. You know, so before you have to assist a client, evaluate the situation, provide a good base of support. Before you want to do anything, evaluate the situation. What do we mean? Before helping a client move, make sure you can perform the move safely. Consider how much you need to carry and how far you need to go. Before you want to help carry, think of how far am I going? What weight? Do I have the weight that it takes to lift a healthy man or to assist him? These are things that you need to understand. They are things that you actually need to comprehend and understand in your caregiving duties. Evaluate the situation. Make sure you can perform the move safely and without strain or injury. Make sure that that particular skill or that particular act that you want to carry out, you can perform it without strain. You can perform it without injury. Because I have seen situations whereby you are going to carry somebody or you are going to assist somebody, and because you don't have the right techniques, because you don't know exactly what to do, it's a matter of you falling and the person, you are falling, either you falling on the person or the person falling on you, or two of you falling on the floor. You can imagine how that kind of drama would be when you are expected to be the specialist here. So you now fall on the side, or the guy falls on you, or both of you fall on yourself. You can imagine. So when you want to do these things, it is important that you weigh them, you look at the plan to use. If you cannot do it yourself, please get help. You get help. Or you use an assistive device. You help. There are so many assistive devices that we're going to see. You use the assistive devices to help. Provide a good base of support if you need. Provide a good base of support if you need help. What do we mean by good base of support? Before you support any weight, make sure that your body is steady. Your body is steady. and you have the right, that's you are firmly on the ground, your body is in a strong position, and make sure that your feet is spread, your shoulder is spread, your feet is spread. Why? So that there is pushing any effect of weight that you are trying to sustain. But never mind, like I told you, this is the theory. We are going to see it in the practicals, how to do it. By next week, we are going to see how to carry that particular act practically. So this is just theory for you to have it at the back of your mind and walk through. Okay. Yes. Now I want to ask before I just want to quickly ask before I proceed. I want to ask. Before you carry somebody, do you think about how you stand when you move heavy objects? Do you lift? I'm asking this question because I just want someone to give us, maybe one or two persons to give us an answer. How do you stand when you want to lift a heavy object? Do you lift the object with your legs or your back? From where does the support really come from? Which one do you think is better? Are you supposed to support that heavy object with your legs or with your back? Which one, please?
From the
Who is helping
back.
us? Okay,
from
with
the
your
back.
I think the support comes from the back.
Okay. Yes. This is what I'm not asking where the support comes from. I'm asking which of it is important, which of it is better. Is it better to support with your back or support with your neck? Which one is better? That's what I'm trying to talk about
From
here.
the back.
So okay, from the back.
Okay.
Madam Kusan, I can see your hand is raised. Or have you answered?
No, so I think for me, your legs, because first, if you look at the previous slide, you need to first, when you observe the situation of the client and the mobility need the client has, if you're not firm on the ground, your feet is not firm on the ground, it would be difficult for you, having that spring to lift up the person. But in lifting up the person, you also need to, talk to the person to know which side it might be the pain from another side or which side. Some of us are firm on our left leg, some are firm on the right leg. So when you're lifting, for you, the caregiver, you should have balance. So for me, I believe it's the legs. Then once you're firm, it will be easy for you to help the person up.
Okay, thank you so much, Madam Kusan. Thank you. So like I said, I just wanted to update your feel, rather, I just wanted to hear your opinions concerning it. It's actually advised, and it's actually correct and advised that when we are lifting a heavy weight or we are assisting with anything that has weight, we should lift the support should come from our legs. We should use more of our legs to lift, the support, the energy, the stamina, everything comes from our legs than our back. Because when we use our legs, it helps us to distribute the load evenly. Your leg has already given you that balance, like Madam Kusan said, has given you that balance. So it is important. Why I ask this question is most times, like me, up until now, before I really got into the healthy, I just try to see my back. I want to lift. I use my back, but like I said, that was the error that my mother did when she didn't have the knowledge. Most of the things she was using her back to get the support. Her back was, and that's why she's having this particular issue that I earlier. So proper lifting techniques is very important. When you use your legs, it helps to distribute the load evenly and reduces the risk of back injury. That is the main thing, because if you keep using your back, if you use your back, you are prone to having back injury sooner or later or in the nearest future. So it is important that we use our legs. So you see that proper lifting technique is especially important for caregivers who may need to lift heavy patients or objects frequently because of the nature of your work. It is important that we have to know. It's important that we have to know how the techniques, how we should go about lifting our clients or any heavy load. So right here, we can see some common care practices that are here. Avoid rushing yourself and the clients. Use assistive devices. Do everything you can to maintain their dignity and privacy. If need be, you have to, like I said, there are privacy is very, very important. Their dignity is very, very important. Their dignity, you have to ensure that they don't feel less of a human being. I keep saying this thing because people that have disability issues here and there, like I said, they feel easily. Any little they'll say, oh, because I'm like this. Oh, if it's not because of this, I've had experience. That's what I'm saying. Small things. Sometimes you, the caregiver, if you don't even have a good heart, you even get angry and say, because they complain a lot. These people actually complain, and you don't look at their complaints, but you look at the fact that they are almost a human being before this particular illness. So when you know that it's the illness that is creating all this, it will help you to handle them more and better. So thank you. Let's go. These are some of the assistive devices for walking, for transfers that we can see here. Transfer board, draw sheets, mechanical lifts, the canes, the crutches. We have all these walkers. These are things, a few of them, of them that we can use to transfer. Like we'll see one or two when we actually have the practicals, and we'll see how we can do that, how we can transfer using one or two devices. So now, assisting a client to walk. This is another skill of a caregiver, because most times your duties involve you maybe taking your client out for a walk. So it is important for you to know how to assist a client to walk. Before you assist or attempt assisting a client to walk, prepare for the walk before you start. Communicate with the client and look around the environment to make sure that you are both ready. Before you attempt to carry somebody, make sure that the road, that the pathway with which you know where you are, excuse me, you know where you are taking the client. So you should ensure that the pathway is free from clutter, from things. The place is free, and then you ask yourself this question: do you have what it takes to convey this person or to walk this person to so place? It's a mental thing. You first do the analysis first. That's why a caregiver, you have to be proactive, you have to think, you have to be smart. Now, clarify with the client where they want to determine the level of assistance they need, like we have different assistance, the other time extensive, limited, and so on. So what kind of, is it that the person cannot walk at all? What is the level with which the person can walk? Am I going to have, is person going to use most my own weight to walk? Is person going to use my own feet to walk? There's something they call 2-man assist, 3-man assist. When we get into first aid skills for caregivers, you will see it. There are times a person that cannot walk very well can use your leg to walk. Is a skill. Can use your own leg to walk. Use all the person needs is to place the leg on top of your leg, and it is your leg that is moving, but the person is also walking with you. So these are some of the things that we'll learn when we'll get to the practical aspect, because you will understand it better then than as I am talking. Now, once the client is standing, suggest they stand a few minutes and stabilize their balance before walking. This is very important. Anything you want to do with someone, not only a person that is ill. If someone sleeps for a while and you want to stand up, ensure that you don't just stand up like that. Get up first, like I tell my children, even though they are small, or I tell anyone that cares to listen. Stand up first. What I mean by standing, or maybe you're in a lying position. Get up from the lying position. Take a sitting position before you eventually stand up. Don't just get up from the bed and off you go without standing up. No, take a sitting position for a few seconds. Why? So that your blood can circulate back. Lying position, it has automatically, and this is more of biology and medicals I'm going in, but I just feel I should, because it will help anybody. There are many times you stand up. Maybe you were sleeping deeply and you just stand up like that. You find out that you get dizzy. Sometimes it's difficult to maintain your balance. I'm even talking of someone that is free of any that's, let alone a person that is ill. So these are some of the things. Even when your client needs to stand, suggest that from sitting down and the person wants to stand, let the person stand up and maintain balance. You understand? First, for some time before the person eventually starts walking, so that they can stabilize. That is the essence. So that maybe the blood flow can return and normalize before they can actually walk, and encourage them to stand straight and move. Never you rush. Do you see what I said? That in a caregiving setting, do not rush. Don't rush it. Don't rush, because sometimes most of the things you need to do them gently. You want to feed the client, you need to take your time. You want to take them for a walk, you need to take your time. Don't say, oh, I have about 10 people to take for a walk now. Oh, you don't want to move. Let's get to that place fast. I need to be. No, you don't do that. You don't do that with these people. You just take your time. You understand, with them. So everything you do, you take it slow and steady, just like that with them, because they are fragile, and they need your understanding and your patience with them as they carry out their activities needed for their well-being. Now, also assisting a client to climb the stairs. Climbing a staircase can be challenging for a person with limited mobility. Can be challenging. A person that has limited mobility, that cannot walk very well, like agility in walking, can be very challenging. But before you help a client up the stairs, make sure you know the client's diagnosis and the level of support they need. Know the level of support. Which of them do they need as they want to climb this stairs? Am I going to support them fully, or I'll just lean gently, rest my hand, and just give them a little bit of support? How are they? What do they actually need? And for such people, let them climb stairs that have railings. We advise people to have railings when you are living in a house that has staircases. Have railings. And encourage people, encourage your children, encourage anybody that has to be climbing to use the railings. It is important. That is why it is there. Use the railings, or use if not railings, I don't know what other name I can give to it. Like, make sure you hold, even without you having mobility. Anytime you can, make sure you hold support, so that you'll be able to move and get your balance and steady on it. So when you are assisting your client, there are many things. Climb the stairs. There are many things you need to do. Either going up or coming down. And anytime you're assisting someone to climb the stairs, stand to their weaker side. Stand to the side that is weaker, just as you're already there. Even as we are, even without illnesses, there are some people that have their strength lie more in the left side. There are some that their strength lie more in the right side. We are all different people, unique people with differences, individual differences, and a whole lot. So we may not have the same. There are people that are very strong with their right or with their left. There are people that are, so these are things. So when you are handling, you see that even as you are handling a client, you have to know everything about your client. That's one of the principles of person-centered care. So as a caregiver, you must know the side that is stronger, like your client's stronger side, and the side that is weak. So if you have to support them, stand by the weaker side, support them, tilting to the weaker side, as if they have one. They should hold the railing to their stronger side while you are supporting them with their weaker side. Very important. We will get there. We'll get there. Now, safety with transfers. This is important. Safety with transfers. Transferring your a client from bed to the wheelchair. We are going to have the practical show of it. What to do if you feel strain, for instance, if performing transfers incorrectly, like with and cause injury to both the client and the caregiver. This mobility is very important, because if you are not careful, you fall, the client falls. You can imagine such drama in a care home or in a care setting. So it's important that we do everything we need to do right and correctly. We always reassess the situation. If you feel any strain in your lower back, it's a warning that you may be injuring yourself. Stop the transfer and get help. Don't try to be strong. Don't try to be, I don't know the name to use. Get help. If something is beyond you, get help. Don't want to say, oh, let me be an excellent caregiver. You are attempting to do something that will have its effect on your back, on your waist. But once you hear the sign, any sign like this, don't waste time. You shouldn't even wait until you hear sign. You should follow the normal processes. Like you don't have sign. And never you say you should put your arms around your neck during a transfer. No, that's a no, total no. Because someone holding your neck, there's anything, you already know what the result is. Now, when you are transferring the wheelchair, a client from bed to wheelchair, also understand that you have to remove the footrest. We are going to do it. Remove the footrest. Ensure that you remove the footrest and the wheelchair is locked. Because if it's not locked, as you are transferring the person, the wheelchair is moving. The wheelchair, any little push, if it is not locked, it is moving for anybody that maybe has disability, has mobility issues. So these are some of the things that we need to know. Falls and prevention. Good. Now, elderly people are prone to falling like my mother. My mother, though not too old, she's just about 60, but sometimes you hear her, she'll say, oh, I went to the toilet, I fell down. I went to here, I fell down. And now, because of the knowledge I have, I just and I help her do the things I know how to do best. But earlier on, before, when my grandmother used to fall, we would just be laughing. Grandma, why do you always fall every time? Must you be falling every time? Is it that you cannot see anymore? Let's look for, we just tease her and all that because we didn't have the right knowledge. But falls are a major health problem for older adults. That's what I want us to understand. And if we are caregivers to older adults, then you know that certainly falling cannot be 100% ruled out. So it's a concern for people with certain developmental disabilities, people that actually have issues, maybe dementia, maybe asthma disease, or one thing or the other. So understanding what these falls are and how to handle them is very, very important to promote. Like you can see that elderly man there falling. Thank God that he had his assistive device and he fell down on the floor. So it's something that they do every time. So falls are common, yeah. So every time people fall here and there, we keep having, after every 11 seconds, an older adult is treated in emergency for falling and
you carry the good and cases now.
Falling and maybe hitting the head somewhere or something. So diseases and conditions that increase the risk of fall, like they are here, the stroke, joint or heart disease, neuropathy, delirium, dementia, Parkinson's disease. These are things that already, these are people that we handle. So you see why I said that they are prone to falling. And why are they prone to falling? Aside the age, because of the illnesses that they have, it increases their risk of falling. So now, tips to reduce fall. So if you know that you're a caregiver and you are handling those people that are ill, that have one challenge or the other, there are things you need to know. Because falling will cause injury. They'll either get injured or fear. They'll get afraid. These people, when they fall, like my grandmother, when she falls, she'll be so scared, she'll be so scared. So fear and loss, injury, even death results from fall. Those are the consequences of fall. So if you have an elderly person, you have a mother, or you have anybody, you really have to work on them concerning this falling. You have to do the things that you need to do to decrease, to reduce this falling risk. Now, keep walkways clear, especially to the bathroom. Keep walkways clear. Make sure you don't keep things here and there. Organization is one key skill that the caregiver has to have. Keep the things where they're supposed to be, in places that are not in the walkway. Room and stairs should be free of clutter. Remove throw rugs, like we talked about it some days. Rugs, don't fold the edges. Let them use rugs and don't use tiles. I advise that if you have people that you are taking care of in a care institution, tiles are not even recommended. You use things that have the cushioning effect. For rugs, except the edges are folded, that someone can fall. But rugs are not easily, people don't easily fall on rugs, but on tiles especially, that is where you have smooth surfaces. And these people too should ensure that as a caregiver, what your client wears matters. Because your clients cannot, where maybe you have a client or you have a patient that you're taking care of as a caregiver, and the person is wearing a shoe. This shoe they call it 10 inches above the ground, like he's wearing a high heel shoe and is attempting to walk. It cannot. They will definitely fall. Or maybe you have tiles that is smooth, a smooth floor that doesn't have any cushioning effect. It can easily fall. Stairs should have strong railings that they will be able to hold. It will help them move gently. They can support themselves and still take the work. Remember that the struggle, your duty is to ensure that you allow them to be independent. Let them do as much as possible the things they can do. So if they even attempt to walk, then all the things, everything should be put in place to ensure that they are able to manage to work, to do the things they can do best. You only are just there to support them. These are very important. Use night lights in a client's room. Keep frequently used items on lower kitchen and bathroom cabinet shelves. Like for people that can still manage and work, the things that they are prone to using, keep them low. Don't go and keep them high, where they'll be struggling. Maybe you are not there or they don't have any help. They are struggling to reach out to. They can fall. Very easy. Use safety toilet seats. We have specific toilet seats we call safety toilet seats that make sitting easier. Use mats in showers and bed and tops. This is something that is very important. Mats and tops is important in the toilet, mat. Because we've had several people come out of the shower of the, not shower per se, of the, what do they call this? Bathing tub. I don't know, bathing tub. So they are trying to come out of it, and then they just slip and fall. Not only people that are ill, many people I've had so many instances that on Facebook, or that one has not happened to anyone I know anyway, but they just came out, and because the floor is slippery, they couldn't get their balance. Immediately they came out, they came in contact with the slippery floor, and they slid, then they fell. And that kind of falling, what it means. I don't wish my worst enemy that kind of falling. I don't wish my worst enemy that. So what am I trying to say in essence? These are some things that we can do that can help us to push in the effect. Now, when we get to the practicals, we are going to see other ways that we can help. Aside the assistive devices, we are going to take a look at some of the things that we need to do. Like I told you, this training is packed. We are going to have first aid skills for caregivers. We are going to see some of the things that you need to know as a first aider. Very important. That is why I thank God that a couple of people here have the mental health. They had a mental health training that was organized by BCC UK, and that's good. Then we also have, like I emphasized the other time, we also need to have CPR knowledge, because even the one we are going to do is just one of the modules. We are going to do it. We are going to teach you what you need to know. But it is important because basic life support, first aid skills I beg your pardon, CPR and first aid, AED, it's a different training altogether that you need to be certified for. So as a caregiver, if you are certified as CPR, that's you've done the BLS training, or you have the CPR and first aid AED training, they are added I don't know how to put it, advantage. You have an advantage over anyone that is just a caregiver, because you know what to do. Why? Because you can give first aid when the situation arises. You know exactly what to do. So when something happens, you will not panic. Maybe you have a client, and maybe by negligence or one thing or the other that you did not know, the person falls and you don't know what to do, you begin to shout, because it happens when there are accidents, when things happen, people that don't have the first aid knowledge, you see, they just crowd around there and they begin to shout. Nobody's actually helping this person because they don't have the first aid knowledge. The only help they can do is to shout and shout and shout and look left and look right and be in a confused state. So knowledge is actually good because it distinguishes you in certain situations and in certain scenarios, and it gives you an edge over others. So it is important that every caregiver has. I'm happy that a couple of us already have this certification. It would help you to be a better caregiver. So those that don't have, it's important you look out for them. So now let's go to the last module within the next 1 hour that we have before we leave, which is the skin and body care. Okay, I have a question in the, I don't know. So do the organization give BLS support and trainings? Okay, I don't know, Madam Kusan, if your hand is raised now, or it was the first hand raised before.
Just raised now.
Okay, please, you want to make a contribution? I don't only want questions. I want contributions too.
Yes, it's a contribution, ma'am.
Like you, like you contributed the other time. So me, I have learned that. And I also remember it that I learned it from you. So I need to learn more, please. Go ahead, madam. Go ahead and give us your contribution.
All right. So just to add to what you talked about, looking at mobility devices, it's also very important not to touch without asking from the client to touch their mobility devices. And then where they keep it, you should not move it, because this is one of the reasons, some of the tips to prevent your client from falling. They're used to maybe putting their wheelchair or their, depending on their assistive, close to the bed. Yes, and then you move it, and then the person gets up, and in the process of looking for it, the person can fall. And then also tubs are discouraged, especially for persons with and then the elderly, because going into the tub and coming out of the tub, even those of us who are even younger and don't have any form of impairment, we still, from time to time, slip or even fall going in or coming out of the tub. So it is most of the time advisable that for rooms, the bathrooms for elderly or persons with one form of impairment or the other should not have tubs, so that that also prevents that. And then always, as you always talk to your client, know your client, always talk to the client. You're working with the client, you're trying to lift the client up. Am I walking too fast? Should I slow it down? Should we take a break? Do you think you should rest? So you're constantly, someone says that your client becomes your best friend. That's the person you keep on talking to all the time you're working with, because you need to be in sync with the person. If not, one step you take. And then also encouraging facilities. Instead of having steps, they should have ramps. So it's easier for the person. Yes.
To move.
And then, yes. And then also in the event whereby you have a client who has visual impairment and also another impairment or elderly, as you're working with the person, you are describing things around the person. So the person is aware of the environment. Oh, we're approaching stairs. We're going to take the left turn. Where in 10 steps, we're going to take this. So the person is imagining, has a visual
understanding,
understanding of the environment. Yes. So that's just what I wanted to contribute. Thank you.
Wow, that's nice. I know why you are making this
This person has
lofty
gotten the caregiving job straight up. That is not. Hello.
I'm coming. I'm going to yes, ma'am. I was just about saying something. Thank you, Madam Kusan, for those contributions, because I'm like I said, that I like to hear from people. I am learning and also buttressing the things I've already said. I'm learning from your own experience as well. Thank you so much. Like we said, not only for the disabled, TOPS are discouraged because everybody, we've been having incidences, issues of people, slipping and falling and all that. So even in homes like mine, I don't have a top. Are discouraged from having tops these days because of the frequency of accidents. So and then the communication, like you said, cannot be overemphasized. That I said, for you to be a person-centered caregiver, you have to do more communication every step of the way, talking every step of the way. Thank you so much. Yes, another person was saying something, Madam.
I was just trying to say that the last speaker is already in fact he has gotten a caregiving job already. I mean, his level of experience is something else. So he has gotten the job already. Another caregiving job already.
Do you think? Yeah, you are correct, Madam Kusan. I don't even know. She's already, in fact, she has been a caregiver for years. The little I know of her, it's just that she refused to collect the caregiving certification. Maybe it's now she wants to collect this one. And she has so many other certifications, and she deals with the disabled.
Any employer that listens to her will give her immediate employment, sharp.
Yes. She does humanitarian service. So that's why.
I will
that's
transfer.
why. Pardon? Okay, so thank you, Madam Kusan. Anybody that is willing to hire the services of Madam Kusan should just reach out to me. Then I would, pass through me, so I will be able to make you to work with her. She's been doing humanitarian work, helping the disabled for years, so she knows how to handle.
Experience is really the key on this matter. Experience is the key.
Yes, is the best teacher. Thank you.
Please, you better go to Instagram and start training people as well on caregiving.
Yes, I am not even ready to let her go. I am not ready to let her go. Seriously, I'm not ready to let her go.
You have to become one of our instructors.
Yes, I think I will talk to her.
I will just learning from the best. Thank you.
All right, so let's look at skin and body care. In the absence of any other thing, let's see how to be fast. And this is the last module, so we'll be done. Skin and body care. Now, our skin is very, very important. Our skin is very, very important to us as human beings. Our skin is practically the largest organ of the body, because it's your first line of defense. If anything, any hot thing gets to you now, your skin is your first line of defense. Any cold thing or infection, anything at all, the skin is the first line of defense. So age and chronic illnesses can make skin to become thinner and drier. with age, like we talked about, and healing are not healing as easily as a younger person. That's why when a younger person has an injury,
Please call your dog.
An older person, please, nobody should go near dog. Me, I'm so scared of dogs. I don't even like them. All right, so the loss of a layer of fat just below the skin, decreasing the ability to stay warm. Sweat glands losing the ability to cool the body. So as a caregiver, it is important that you know how to handle your clients. You take care of your client's skin. Like we already heard, your client is your best friend. Check, even if you are not a professional caregiver, for God's sake, we have mothers, we have grandparents, we have people that we work for, we have people living with disability. It is important that we check them. When you are taking care of them, check their body, observe them, see what is happening. Because as a caregiver, you are closer to a client than a nurse. Like I already said the first day, I really talked more about this. Your closeness is people want to hear from you because you have that first-hand information. You should have the first-hand information about your client. So this is important. You can help promote your client's skin by keeping it clean, by keeping the skin dry. Okay, by keeping the skin dry, using moisturizers, creams, and lotions, and encouraging good food, good nutrition, ensure that they eat well. This is important. I know that it's not easy for people that are not, people that are ill in terms of eating. You know, it's not easy for them. But what can you do? As a caregiver, you have to ensure that they eat well, because when they eat well, it will go a long way in helping them to get well, because eating food, of course, is what we need. Okay, now I want to quickly, as much as possible, before we actually delve deeper into this, I want to give you, and I want to tell you something. I'll give you an illustration, just a short story, like I like to do. A few years ago, when I was caring for my mother, for my grandmother, I beg your pardon, my aging grandmother, I noticed that her skin was becoming increasingly dry and sensitive. You know, that we didn't know. We didn't really know much, but good enough. We had someone that actually had the right knowledge. So caring for her, I observed that her skin was increasingly getting dry and sensitive. She would often complain about itchiness in her body and discomfort, especially after her daily bath. Each time she takes her bath and then she comes out, after some time to complain of her body itching her, you know, and her body being so sensitive, you know. So as someone who had already taken great pride in her appearance, because this my grandmother was a person that was very in her early years. She used to be she takes time, she spends money to take care of her skin, she takes care of her appearance. So, but you see that illness has now wants to turn her the other way around. So you can imagine how this would affect her. So as someone who had always taken pride in her appearance, this change in her skin health was really starting her mood and self-confidence. It was affecting her mood and affecting her self-confidence. So one day, as I was taking her get dressed, I noticed a red irritated patch on her elbow. I noticed something like a patch on her elbow one of those days, you know, and on closer inspection, I realized Dayo again. Mr. Dayo, I don't know. I don't know. Okay, someone, sorry, I beg your pardon. That person should forgive me. Mr. Miriam, okay, Miriam, I was thinking it's Mr. Ade. Miriam, you asked a question, which I did not address. You said, do this organization give BLS training and certifications? Of course, yes. BLS, that's basic life support, and caregiving certifications, mental health, any training that you need that will help you to boost your portfolio as a caregiver, please do not hesitate to reach out to me or to MJB, or you can get to the website of BCC UK and then log on to the trainings there. Any training you see there, know that we run these trainings for. MJB is their Nigerian provider, so we take these trainings for BCC UK. So we run basic life support. We even run advanced cardiac life support, ACLS. We run a couple of first aid and basic first aid, standard first aid. These are trainings that we run. So anybody at all that you need any of those trainings, please do not hesitate. Just reach out to me. I'm not a marketing manager or of MJB management. But since that question was asked, I must tell you, because it's like someone just having a caregiving certificate and going to look for a job, and someone that has that certificate has a caregiving certificate, so the more certificates health related you have boosts your chance, increases your portfolio, and gives you an edge over anybody. That is what I tell everybody and anybody that cares to listen. So let's continue. Sorry, I just remembered I didn't address that question. So I said, let me come back to it. So I was talking about my grandmother. So upon close inspection, I realized that it was pressure sore that had developed from her limited mobility. So I felt terrible that I hadn't caught it sooner, and I knew we needed to take immediate action to prevent it from worsening. From that point, I made it a priority to focus on her skin care routine. That's what I'm telling caregivers. Skin care routine is very, very important. I even started involving my mother in the process, asking her also to bring her input as to how we can help grandma, the products we can use, those that will be mild on her skin. And doing that, I noticed a remarkable difference. Her skin began to regain its healthy glow. And most importantly, I could see that it had a positive impact on her overall well-being, on my grandmother's well-being and quality of life. So this experience really made me to see how crucial skin health is in the context of caregiving. Nobody should take it for granted. It's part of your duties. You have to observe. You have to observe these changes so that you can document, so that you can do something about it. You can see redness sometimes, you can see swellings, you can see changes in temperature, you can see break in the skin, rashes, sore, and so on and so forth. These are things you should at all times look out for in your clients. Now we get to pressure injuries. Pressure injuries. Now once again, I don't like to, it's like I'm telling too many stories, but I like to tell stories so that you relate more to what I am saying. Now, pressure injuries are very common among older adults. They are painful and debilitating. It can affect them and it can lead to serious, even life-threatening infections. So that is where mobility too. A person should not lie for too long. A person should not lie for too long in a particular position. It is wrong. Pressure injuries are very common, and one of the greatest cause of pressure injuries is immobility. That's not moving. Being immobile, that's immobility. It causes pressure injuries. It is considered as the number one cause of pressure injury. So when a person sits or lies in a position too long without moving, the weight of their body, it puts pressure on the skin and on the muscle. That's what I want us to understand. Not only for someone that is ill, even someone, the only difference that someone that is not ill, you'll be able to stand up when you are lying more, you can stand up on your own, you can do things on your own, so it's less. But for people that have these challenges, they have to like move up, step up their game. You understand? They have to, you as the caregiver, you have to ensure that they don't lie for too long. They have to keep turning. Like, I don't know if it is on this platform or if it was the former caregiving training I had. I'm trying to remember because I've had the first batch we had for this year. Now, I talked about a friend of mine that had a mother that was bedbound. She was always on the bed. She couldn't turn. She cannot even turn herself. So what did my friend do? Even as a worker, excuse me, even as a worker, working with me, she had to take permission every 2 minutes. It doesn't, after some time, you see her, before you know, Christiana is out. Before you know, Christiana is out. She's left the school. She's taken permission and left. So one day I talked with her. She said, I always go out so I can take care of my aged mother. That where you keep her on the bed is where you see her when you come back. She cannot even turn from one side to another. She cannot even turn. Where you keep her, she just remains like that. I have to go and ensure that I turn her, and that then I didn't understand. But having learned all this, I understand that it's not good for someone to lie in one position for too long. Because if you do, what results is pressure injuries. You will have too much pressure on your skin and on your muscles. So the pressure can be from the bone, can be even from a bone. pressing against another part of the body or from a mattress or from a chair. So all this unrelieved pressure cuts off blood supply to the skin. When you keep your pressure, you are being in one particular position for too long, it cuts off the pressure. You understand? The pressure becomes too much. So blood circulation is affected. And what results? Pressure injuries. So that's what we are looking at. So pressure injuries, because of the people we are handling, because we are caregivers, we have to be conscious of that. If you are handling a person, ensure that after some time, you turn the person, let the person, if the person is bed bound, if the person is not bed bound, you can take the person out, walk a little, depending on how the case, the person's service plan is, walk a little. Why? So that the person will keep, circulation will continue, and there will not be too much pressure of the person being in one position. Even those that use wheelchair too, from time to time, they have to have a form of shifting themselves, tilting themselves, you know, so that blood can keep moving and there will not be a stop in the supply, in the blood supply, to result in pressure and injuries. So these are some of the things that can cause those pressure injuries that we are talking about. Too much moisture on the skin, irritation by urine, malnutrition, dehydration, a whole lot of things can limit circulation. So please, I need to let you know, like I need to, but the fact is, just for formality, I need to let you know that the next screen we are going to be seeing is going to be a little bit sensitive. So if you are a person that is sensitive to pictures, I'll advise that you maybe, I don't know, step aside and allow us to do that. But if you know you can handle it, it's fine. Because as caregivers, of course, you should be able to handle this picture. I just felt to warn you before we move. So we want to look at this different pressure injuries, how they actually look like. Okay, so we are here now. What pressure injuries look like? Like you can see there, most people, they just wear shoes that really mount pressure. You can see like that person at the back of his, you know, it has just skipped that's the back of his legs. You can see that place. You can see on the knee. You can see. So we have different layers of our skin. Different layers. We have the epidermis. We have the dermis, epidermis, which is the uppermost. We have the dermis, we have the subcutaneous fats, we have the soft tissues, we have the bone. So when we have these different pressure injuries, they have their different steps and they have their different degrees. Like you can see the first picture there, the pressure injury is just on the surface. That's only on the epidermis. It has not affected, it hasn't moved to the dermis yet. You see the second one has spilled over to the dermis. You see the third one, the more serious one, has moved, has passed the epidermis, has passed the dermis, you know, has gone down. We have the last one that actually gets to the bone. So these are examples of how pressure injuries actually look like. This is how they look like. So if someone sleeps for too long, you find out that, like I want to talk about my grandmother too, when we didn't, my paternal grandmother this time around, she was always left to lie on the bed. Did we know anything? We didn't know anything as at that time. Now we didn't have caregiving knowledge. We didn't just so many things for granted. That's why knowledge is very sweet. It's important. So we will leave her sometimes. So what I noticed was that anytime, I think I gave this illustration in the first caregiving training, the first batch of this year. You know, I told them this. I gave them this particular illustration that my grandmother would just lie like that. And we didn't really, because all of us were all hustling, looking for money, doing jobs here and there, weren't really around her. And then the lady there would just leave her, the nanny, I don't know if nanny is the right word, but the person taking care of her, the caregiver, yeah, will just leave her. So we observed that she was having peels, her back, she was having wounds on her back, wounds and wounds and wounds. We didn't understand until when we took her to the hospital, we were told that it is pressure injuries, that they leave her to lie down for too long. So when you go to carry her, it's like her back is following. It's like her back is following the bed. Her back is following the bed, like you want to lift her up. Excuse me. You want to lift her up, and to seem as if her back is following the bed sheets, you know, because of what? Because she has been lying down for too long. So pressure injuries happen not only on the back, on different parts of the body that there's so much pressure on. And most of these pressure injuries appear where we have pressure points. Like we're going to see pressure points. We're going to have all the pressure points on our bodies, which we also feel it, and you too, you'll be able to tell me the other pressure points that are on your body when we get to the practical session. So these pressure points are actually, it worsens. When you have these pressure points injuries, it worsens when they are in pressure points in your body. And those points that are prone to pressure in your body, which we are going to see, like we are going to have the practical demonstration of it. Like you see the outer ankles, the outer knees, between the knees, and so shoulders. There are places in our body that are prone to pressure point injuries, prone to pressure injuries. So, and they are pressure points. So we'll get to see that as we progress. So now we are also going to look at a skill, which is, I said I don't like talking, but we have to hit 8 o'clock. No question. All right. Please, if you have any question, kindly drop it in the chat box. I'll pause and attend to it as we continue, because I don't want us to exceed 8 o'clock here. So a client needs to change position frequently, like we said, to protect their skin. We are talking about skin now, the largest organ in the human body. So a pressure injury can start as little as 1 to 2 hours for clients in bed and unable to move. You see, so intermittently, from time to time, you have to keep changing. Clients that sit in chairs and cannot move can get pressure injuries in less time because the pressure on their skin is greater. Now, these are some tips that you can tips that you can put on your fingertips to remember when repositioning a client. So we are going to take that particular skill, turning and repositioning a client. Now, the following are the skills that you need to know. When you want to turn and position a client, make sure there is room in the bed to roll the client. This is very important. Make sure there is room. You know you want to roll the client. Ensure that there is space in the bed for the client to be able to move. The space, you have used your eyes, you have weighed it, you have gauged it to see that, okay, when I turn this person will be in this particular position. You do a form of calculation within yourself. Secondly, ask the client to look in the direction that they are being rolled. That's another thing. If you are rolling a person to the right or to the left, ensure that the client is looking towards that direction. Never mind, like I said, these are practical skills, that things that we term as skills for caregivers. There are certain things in all this training. So those skills we are going to learn. Like one of the skills is how to turn and position a client in bed. It needs some techniques. Do not roll the client by pulling or pushing on their arm. Very, very bad. It's totally is a no. You don't roll. I mean, you don't push. I beg your pardon. You don't pull or push. No, on their arm. You don't do that. So there are things we are going to note, and there are ways we are going to things we are going to look at. Like you can see this beautiful woman and this beautiful caregiver. Like Mrs. Madam Kusan still said again, to buttress what I have been saying, you see even the smiles on their faces. You see the smile. The elderly woman is happy. Like she's happy to be turned. Like she has given her consent. She is in support of the fact that she can be turned. And you see the caregiver too is also smiling. Like we talked about non-verbal expressions. You cannot want to go and turn the person and you are frowning as if you want to fight with the person, you know. So this is, as a caregiver, you have to have an amiable disposition. That is just what you have to have, an amiable disposition whereby people will love you. That's you are easily, I don't know how to put it. You are easily, your client can easily relate with you. You are patient, you are empathetic, you are considerate, you are all the skills. You need a whole lot of this to be able, you are kind, you can understand how someone feels. I'll beat you. You can really understand how your client feels. So look at even the act. You see, it is an enjoyable act. You can see between the two of them that they are happy, like the person is happy, you know, and the caregiver too is also communicating, talking. Like I said, communication is very important. Let at all times, person-centered care, let the person know what you want to do for him or her and get the person's consent. Let the person affirm. If person cannot talk, at least with the nodding of the eyes or with the twitching of the eyes, you should be able to understand non-verbal expressions. So fine, now we want to look at body care. Body care. Our body is important. Our body is important to us. So proper care of the mouth and teeth. There are so many skills that we are going to learn under this body care, because our body, our teeth is there, our leg is there, our hand is there, our mouth is there, and so on and so forth. It is important that we take care of our body. This training also is also for you, the caregiver, taking care of your body, and also for your clients, how you can take care of your clients. So Proper care of some parts of the body, not all the parts of the body, is very important. Care of the mouth and teeth support a client's overall health and helps prevent mouth pain, eating difficulties, speech problems, digestive problems, and so on and so forth. It is even better to brush after every meal, like some people say. Sometimes it is good to brush after every meal. And your teeth should be flossed at least once a day to keep the teeth clean where the brush misses, because it's not every part that the brush will actually get when you are brushing your teeth. So that's why flossing is important, so that I can bring out any leftover. I can clean the parts that the teeth brush, that your teeth a toothbrush cannot actually reach. So this is very important. Now, these are, these are some of the skills that we need to learn as caregivers. These are some of the skills that we need. So let's look at them. Now, one of the skills that we want to learn is the mouth or oral care. Mouth or oral care. Now, what are the things that we need to know in the mouth or oral care? We are looking now, I want to just have an idea of how our body looks. So what are those things that we really need to take into consideration when we are taking care of our body? Now, proper care of the mouth. Let's look at the mouth first. And teeth supports a client's overall health and helps prevent mouth pain, like we talked about, speech problems, digestive problems, and a whole lot. So you see, your mouth is very important because it is the part with which something goes inside your stomach. So your mouth is very, very important. So providing oral care can promote a healthy appetite. If someone brushes his teeth, keeps his mouth clean, it can even promote the person's appetite. You know, a person can want to promote the person's appetite, rather. So to help prevent decay and gum disease, it is important that, remember, we are talking about activities of daily living. Like we were saying, that is one major thing that a caregiver does. So these are some of the activities of daily living. Brushing teeth. Ensure that your client brushes his or her teeth. Support where possible. If the client cannot do it, you can support in helping to brush the teeth, because it will help prevent tooth decay and gum disease. Very, very important. It is also good to use fluoride toothpaste if available. If there's no fluoride toothpaste, you can also use maybe soft toothbrush, and you could equally use when assisting with brushing. How do you? There are methods that you can use, which we are going to see. You use short circular movement while brushing the teeth. When we get to practicals, we'll see that. Short circular movement. A soft bristle toothbrush is recommended by dentists. So you know that even as a caregiver, you cannot encourage a hard teeth brush, the teeth brush that is hard. Sometimes I remember one time I bought a toothbrush for my daughter. When I brought it to her and she used it, me, the mother, I just bought it. I assumed that it was okay. But when I brought it, she was complaining. She said, "Mommy, the toothbrush is hard." You see, so it was affecting her. So I immediately had to replace it to get a soft toothbrush. So as a caregiver, you see that you take note of all these things, getting to that, even to the extent that you have to even confirm if the toothbrush is appropriate. You see that a caregiver's duty is a whole lot. A caregiver's duty is not a walk in the park. It's a whole lot of things that you need to do. So these are some of the things that if your client too has difficulty, because maybe your client may be someone that has stroke, cannot really hold the toothbrush. Make it bigger. Get a toothbrush that has a bigger handle. There are some toothbrushes that have small handle, just like spoons. There are some spoons that have bigger handles. There are some that have a thin handle. So if you know that your client has the challenge of he cannot really hold it, the hand of get the one that is bigger, that will give him a firm grasp of it. This is important. These are some things that you need to know. You need to understand. So when you need to, and also flossing too, ensure that you help in the flossing process. It is very important. Another thing is how to clean and store dentures. Some of those people, they use dentures. Dentures is just like teeth, that of someone that maybe has issues with the teeth, they fix the dentures. So how can you clean the dentures? That's another skill, another caregiving skill. Clean. When you want to clean it, like, it's just like natural teeth. Dentures must be properly cared for to last. It's just like your normal teeth. Dentures should be cared for properly. Why? Because they are just like the normal teeth. And if you don't care for them, it becomes a problem. If you don't care for them, you have to ensure that you take care of your teeth, and you know what to do with the dentures. Just the way you take care of your teeth, you take care of the dentures as well. If the client does not have any teeth or he wears dentures, gums and mouth should be brushed and cleaned at least twice daily. There are some things that we used to do. Baby mothers understand. When your baby is small, when there's no teeth, they will advise you to use hydrogen peroxide. They'll tell you use a cotton wool and just clean, and clean, you know. So sometimes you may have a client that has no teeth, or maybe due to one thing or the other, you cannot use the brush, maybe one condition or the other. You can clean too. You learn, you improvise ways to ensure that you help the clients, the teeth to be clean. And if you have challenges with the brushing the teeth or assisting, or your client has challenges with brushing of teeth, it's important you draw the attention of your care team. Remember, I said document everything. Anything you find out of the ordinary, please document. Inspect dentures for cracks when you are taking care of them. Line the sink with the washcloth. When you want to wash dentures, don't just wash it in the ordinary sink. Use a washcloth, line it, lay it on the sink. Just like that man's sink is there, we can see there. Lay the cloth before you wash the sink. I mean the dentures, because it helps prevent breaking in case you drop the denture during the cleaning process. It could break. Allow the dentures to soak overnight for several hours, depending on dentist recommendations or the client's preference. Inspect dentures for cracks, chips, or broken teeth. Check every time, look at it and check. It is your duty as a caregiver, if it is in your care plan, because it's still an activity of daily living. So it should be in your care plan. Good. Do not soak dentures in bleach water. Don't say because it's not clean, I need it to be clean. You soak it in bleach water. We've had somebody do that, like, that almost cost her job. You put it in bleach water because she wanted to bleach it, make it white, to make it clean. So do not soak dentures in bleach water. Bleach can remove the pink coloring, and it can discolor the metal. It's not good. Ask the clients what dental cleansing products they use. Find out from them, because they can tell you either mild dishwashing liquid or special dentures liquid. We have liquids that are specially made for cleaning dentures. Very important. Before you soak a dirty denture, always brush to remove food debris. Sometimes, because they use it to eat, so sometimes there may be food debris around it. So you don't just go ahead to soak the dentures. You first remove the food debris before you attempt to soak the dentures. That is very, very important. Shaving with safety razor. That's another. Okay, we still have no question in the chat box. Fine, we are still soon rounding up. Thank God that network has been favorable. So, like I was saying, shaving with a safety razor. Do not press down hard or move the razor shaver fast over a client's face. That's another. Do it gently. For those that can't do it themselves, like you can see that man there, the things that your client is not able to do. Remember, don't take away the independence from your clients. I keep emphasizing this. Allow them as much as possible to have control over their lives. Do not superimpose. Exercise power with them. Don't exercise power over them. Marry the things that are important to them with the things that are important for them. All the things that we have learned, it extends communication, effective communication with them is very, very important. Also, fingernail cutting too. Fingernail cutting. This is important. That have diabetes. People that have diabetes, they have their own way of you taking care of them, because any sore or any wound or any injury that someone that has diabetes it takes a longer time than necessary to heal. So in the course of you doing your activities of daily living, be very conscious and mindful. Know your limit. If you have to maybe deal with fingernail or fingernail care, foot care or fingernail care with a person that actually has diabetes, be very careful. Now, Nail care may be part of the birth routine. Foot care is covered in detail within the foot care skill. So when you need to, the foot care skill that we'll eventually learn, you also see how you can handle, how you can help with the cutting of the nails when the need arises. But again, when someone has diabetes, you guard the person against any form of mistake of doing something, mounting pressure on any part of the body, because you will not be able to handle the resultant effects. That's very important. So that's why everything in caregiving still boils down to you knowing your clients and knowing about your clients. Know what is in the case, what is in the care plan, what is in your service plan, what is actually the challenges or the illnesses that this your client has, because you will not say in the process, I was trying to cut the nails or maybe to treat the nails or to do something into the nails. This is what happened. I had no idea that this person was diabetic and so on and so forth. No. Of course, it's not an excuse, because you are expected to know more about everything about your client before you even take responsibility of doing that duty. So now let us look at foot care. That's another thing. Let's look at foot care as another skill that we are going to be seeing. So when you are actually giving foot care to your clients, these are some of the tips that you need to know. Inspect the client's feet regularly for changes in color. When you are doing this, remember, you are not only just doing the care, you are also observant of the things that you may report, of anything that poses as danger to your client. Very, very important that you need to take note of that. So you have to ensure that you observe, you check your client's feet, or maybe you may not even be a professional caregiver, even if it's your mother, your grandmother, any aged person you are taking care of. Look at the person. I said it that day. Check the person. Check for any symptom or sign of abuse. We talked about that under client's rights. You know, any symptom of abuse, aside abuse, it may not even be abuse, of anything that poses as danger. Observe the paleness on the feet, maybe wound, maybe any cracks, maybe skin. Just make sure that you see, caregiving is, I don't know how to really say it, because I always speak with passion. Caregiving is something that if you are not, like I said from the start, if you are not ready to do it, please don't even attempt to go into it, because you only create issues for yourself. Don't attempt to go into it, because there are many things that you need to look out for, that naturally, if you don't imbibe the skills, if you don't imbibe everything, the techniques and everything into you will, because sometimes it looks as if these things are too many for a caregiver to be able to do. No, but when you continue doing it and you have the right training and you have made it a part of how much your impact, how much an impact you can make in the lives of these people you are taking care of. Well, once you know all those things, there's no kind of work that will do much for you to do. So these are some of the things. Inspect the client's feet regularly for changes in color, maybe redness, maybe temperature, maybe blisters, maybe cuts, maybe scratches, cracks, or anything like that. There are things that you have to know. Monitor minor cuts and keep them and check. Monitor them and check. Do not put lotion in between the toes. The lotion causes moisture that promotes fungal growth. This is another thing. So the things you have to do, first find out the things you need to do, if they are right. So don't just use your initiative to do something, because there's a place that I went for, is it manicure and pedicure, you know, there they wash the feet and all that. When they finish, they apply cream in between the toes. You understand? So in this case that I'm trying to say, it is wrong for you. Do not put lotion in between the toes, because this lotion causes moisture to build in between the toes, and it promotes fungal growth. You know that most of these people, their immune system is already low, so you don't have to create more issues. Now, also, for most clients, you will only be filing their nails and not clipping nails. There's a difference between filing nails and clipping the nails, two different things. So always verify the client service plan prior to performing foot care. Always know what is in the care plan, what you can do and what you cannot do. So never clip toenails for a client with circulatory problems or diabetes. You know, I already told you that someone that has diabetes and someone that has circulatory problem with the circulatory system, don't go and do all those clipping or all those things to say so that you can be an efficient caregiver. Please don't go and do it. So it's important that we know this, especially clients that are diabetic. You have to be extremely careful. Now, another skill is this. I think we just have 1, 2 skills and then we are gone. Okay, so another skill is assisting a client with bed bath. This is important. Bed bath. We are going to see this. It's a skill every caregiver should have. When we are doing the practicals, we are going to start by showing you what to do, the level of water, how hot or cold the water is, the temperature of the water. Everything we are going to show you how to give a client bed bath. Because sometimes you may have a client that is bed bound. So the client cannot stand up and walk to the bathroom. So you can't leave that client to be dirty all through to stay like that. You have to give a bed bath. That's one of the skills of a caregiver. So we are going to see that practically. It's a practical skill. So a bath can be refreshing and relaxing. We all know. A bath serves other important purposes for a client too. Cleaning the skin, stimulating circulation, providing movement and exercise, providing an opportunity to observe the client's skin. These are reasons why and the good effects of bathing and reasons why a client should bath. It gives you an opportunity to observe like woman to woman, maybe as you see those two caregivers now, or man to man, you observe and see if there are any, or woman to man equally. It mustn't be the same sex. When we talk about, it's just like how do we put it? It's like a male doctor handling labor. It's just in the professionalism. It's not about the gender most times. But also, do not forget that you have to take into consideration what your client thinks. So if your client is that type that is not comfortable in that particular aspect with a man, then you know that, of course, since it's person-centered care, you know exactly what to do. So when you are having bed bath, there are things you have to look out for. Check the body for wounds, for scratches, for anything. And above all, maintain confidentiality, because when you are taking care of your clients, it gets to when we get to toileting, we'll see that aspect anyway. You have to ensure that your client is covered, just like you see that beautiful caregiver doing. She has covered that woman. She's covered her from our view. If that toilet was not there, we'll see that woman's nakedness. So that is what you should do as a caregiver. Ensure that your client's privacy, ensure that you cover up your clients at all times. It is very, very important. They have the right to be covered. Let me use it like that in a layman's language. They have the right to be covered. And above all, anything you see in the bathroom remains in the bathroom. Why am I saying so? Sometimes, like I said, you may see someone thinking the person is female, but at the end, the person is male, because you extend to the bathroom and maybe the person has some features or some challenges that shock you concerning a client should remain confidential, except unless it is needed by law to prove certain things, or it is needed for the betterment or medical, for the betterment or the well-being of that your client. So these are things that we really have to understand. When you are giving a client's bed bath, or not even bed bath, anything that has got to do with bath, like you can see there, this one is actually the bathing. It's not a bed bath because the client is not on the bed. But bed bath, we talk about that when a client is being cleaned on the bed, maybe bath on the bed, but anything that has got to do with bathing, because it's an activity of daily living, as we are talking about it here, it's about the body. You must be very careful how you handle it. The water you use, the temperature of the water, how careful you are, and sensitive parts of the person's body. When you are dealing with someone sensitive, private, that's a private part of the person's life. Bathing is something that ordinarily nobody will want another person to do if you're an adult, but because of one thing or the other, a caregiver has to attend to you when it comes to that. So you see how important that particular aspect of your life is. And as such, caregivers should take it important as well and should give you maximum respect in the course of them doing and carrying out their duties. So, okay, we also have assisting a client with weak arm to dress. How do you assist? There are techniques, how you assist a person that is disabled, maybe has challenge, disability with the hand, in the hand or in the leg, and you have to help in assisting in dressing such a client. There are techniques. Clients who need assistance with dressing often have difficulty doing things that require small finger movements, like buttoning their clothes, zipping it, putting on socks, and all these things. So these are things that you need to do. You need to learn. As we get to the practical aspect, you actually learn how it is done, the technique, how to wear a person that has a weak arm, how do you dress, on which hand do you put, how do you do, and so on and so forth. Or someone that has had a stroke, we need these techniques to actually know how to handle them. Good, just like we can see on that picture there, you can see that beautiful woman doing her job. You can see the other person. Okay, we don't have any question, no contribution on the chat box. Okay, fine. So that's practically it. We are going to learn. So like I told you when I started, these skills are actually, okay, thank God we've come to the end. So these skills are actually things that we can not only talk about them, like I said earlier, they are practical skills that every caregiver needs to know and needs to have and needs to learn. So it is important that when we eventually do the practicals, God willing, tomorrow we are going to look at toileting, we're going to look at nurse delegation, and we are going to look at, I forget, let's see, we are just going to look at the last 3 modules tomorrow. Thank God we have a longer time tomorrow. Tomorrow we have 4 hours against 3 hours that we have today. We are going to see how to address those remaining topics that we have. Then for the 2 days, the last 2 days, like we normally do, we take our time to do the practicals, which is the self-care for caregivers is not practical. So tomorrow we are going to look at nutrition and food handling practices, hygiene and toileting, nurse delegation and medication, self-care for caregivers. It's very short modules, like self-care is very short. So after that, the remaining 2 days, we are going to say, yes, we are ready for you, practical. So at this point, like I said earlier on, it is very important to summarize and everything that I have talked about. It is very important that we understand our duties as caregivers. We do it with all level of sincerity, all level of patience, of being empathetic, feeling the pain of our clients, doing it with respect, doing it with communication, ensuring that we communicate, we don't superimpose, we exercise power with, we take note that these people were first and foremost people that had their lives, we're in charge of their lives, we're doing everything for themselves before the sickness now relegated them to the background as they are. So if you understand those things, you'll be able to deal with a whole lot of things and you'll be able to be the best caregiver that they can ever wish to have. So at this point, like I said, I told you we're not going to exceed 8 o'clock and I think I have tried. So I don't know, do we have any questions or any contributions before we hand over to NJB? Tomorrow we have our training by 10 o'clock. Please do not forget, Mr. One of us, I can't really place the name, had a challenge thinking that the training was in the evening on Saturday, but it was in the morning, so he missed it. So that's why I'm taking time to explain that. Please, as your timetable shows, tomorrow is going to be 10 o'clock to 2 o'clock. Please endeavor to be on time. And if you have any personal questions, what I mean by personal, like someone was asking about where to put caregiving in the CV, was asking in the general group, such a question you should ask in the registered participants group. Anything that bothers you as centers concerning the caregiving proper, and you are a member of the registered participant group, please ask in the registered participants group. I'm always there, and all the admin members are always there. So if you drop it, even if you don't get the response immediately, you trust me that I'll surely give you the response anytime I see it. So on that note, we have come to the end. Do we have any questions, please? Are we together, please? I know I've not asked that for some time, so I hope that everybody have not.
No question from me.
So the men, you are going to be taking the lead, my very able men, distinguished men on the platform. You are going to be taking the lead because today I was really hearing the women talk. So please, the men tomorrow, kindly help us pick up the challenge, men. Thank you so much. So thank you. I know the men are thinking of how to go and hustle to get money and put it on the table. But please, tomorrow, let's be on the same page as we have always been. So thank you so much. I really appreciate every one of you on this platform. I said I needed to appreciate you because we didn't have any break. Like I was expecting somebody to say, oh, doctor, we need to just stretch our legs, just 5 minutes. Won't you give us break? But thank God nobody said, because I was listening and I didn't hear anybody say that. So I want to really appreciate you all for being so wonderful this evening, and everybody that contributed and everybody that have actually contributed to other people's contributions. I want to say a big thank you, and I want you to have a beautiful and a lovely night rest. Over to MJB Management and Integrated Services.
And you too,
MJB.
ma'am. Thank you, ma'am.
Thank you.
All right.
Thank you.
Thank you so much.
Thank you so much, Doctor. Thank you so much, Doctor.
Thank you.
Thank you so much, Doctor. We appreciate you so much. From us over here at MJB Management, I want to tell you that you have been wonderful. And in the course of the lesson, because of the lecture, some of our supervisors came in and they were opportune to listen to you, and they gave you kudos.
Wow.
They said you are doing.
Thank you so much. Thank you. Thank you.
That's wonderful. We anytime we call on you, we are not always disappointed. So thank you very much. Thank you very much. And for our participants, we appreciate you so much for the time, because I want you to know that without you, there will be no MJB Management. Thank you for the support. Good night, everybody. We'll meet again tomorrow. Bye for now.
Thank you, sir. Bye.
Bye. Good night.
Bye.
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 Good
Good night,
night.
everybody.
Bye.
Bye.
Bye. Bye.
Bye.
Thank
Good night.